My name is Maria Ortiz. I am co-chair of Housing, Health, and Human Services. My co-chair is Joe Risucha. And this is our monthly meeting, which is held the third Thursday of every month for Housing, Health, and Human Services. This meeting is being recorded and it is currently live streaming on YouTube. It'll be accessible after the agenda and the materials for tonight's meeting are public and can be viewed on the CB4 website. If you're not signed up for the CB4 e-blasts, I encourage it. You receive the agenda and link to the documents for the meetings beforehand. If this is your first time attending the meeting, the main things to know are first, after each presentation, the committee is going to speak and ask questions. Then members of the public are permitted to ask questions or speak on the topic. And in order to speak, you need to raise your hand. Use the raise hand function on your screen. I don't know, is anyone calling in? I didn't even look at the...
No,
okay.
No.
And after the attendees speak or the public, the discussion goes back to the committee for the business session. And on some items, the committee members vote to write a resolution, which goes before the next full board meeting for a vote. Let's do self-intros, starting with Joe, you.
Joe Risucha, co-chair, Housing, Health, Human Services. Pass it to Betty.
I made it unmuted. Betty McIntosh, member of the Housing Committee here.
Pass to Roberta.
I'm sorry, can you also mention what other committee you're on, Betty?
And I'm on the Chelsea Land Use Committee.
Hi, I am Roberta Barnett, member of the committee, as well as the Waterfront Parks and Environment Committee.
Pass to Katie.
Thank you. Look, Betty, I'm trying to learn from you about unmuting myself. So I am on this committee as well as the Arts, Culture, and Education and Street Life Committee.
Pete.
Member of this committee as well as the Transportation Committee.
Sabrina. Unmute.
Hi, you're all coordinating today. Like, what's going on? Anyway, Sabrina Rodon, and I'm part of the Arts ACES, which is Art, Culture, and Street Committee.
Josephine.
Hi, Josephine Ishman, member of this committee and ACES.
JD.
Jean Danielle, co-chair of Hell's Kitchen Land Use and chair of the Musical Comedy Committee.
Jessica.
Good evening, everyone. Jessica Shade. Apologies for being off camera. I'm actually at the airport, so I'm only joining you for part of the meeting this evening. I'm also co-chair of Chelsea Land Use. Great to be here.
And first vice chair of the board also.
Safe travels.
Thank you. Thank you. Thank you.
Leslie.
Member of committee and Health Kitchen Land Use Committee.
Paul.
Yes, Paul Ames, public member of this committee, which has 100% of my time, although the Musical Comedy Committee sounds like I should hear about it. Anyway.
And I think Travis is our last one, right?
Travis Rogers, public member of this committee.
And we're also joined by Nellie Gonzalez, who's our assistant district manager, who administers and manages the committee for us.
And we will be having another member join us in a few minutes, Aurora Cruz.
And Yadira is also coming.
Yes, she's also, Yadira Jimenez will also be.
Yeah, she and I were at a meeting together, and I live closer to that meeting than she does, so she's on her way home.
And Dolores is trying to get on. She's having technical problems.
Got it.
Thank you.
So, Laura, are you alone tonight?
Just me, and fair warning, I have to hop off at 7:15. So I will happy to answer any questions that we don't get to in the presentation. You all know how to find me, I think. And
no problem.
Jesse certainly does, but happy to talk really quickly.
I just wanted to start out with, first of all, thanking Health and Hospitals for coming to us to speak about the Watson. We're not here tonight to talk about the specific issue of the decision made by the mayor's office to transfer the singles from the Watson to the cruise ship terminal, that kind of stuff. We're here to specifically understand, given the current, what is the demographic of the current population? And specifically, what are the services you're offering there? And how have you managed this transition from services set up for one demographic to now the demographic you're going to describe? And if you can be very specific, laying out, here's how many rooms, here's how many people approximately, here's the nature of the population, the asylum seekers, lay that out first so everyone understands what we're talking about, and then go into the services. Take it away, Laura.
Absolutely. And thanks so much, Joe. And I know, folks from this committee and from this board have toured the site previously, have seen the setup, and also have given us incredible feedback. The reason that there is a beautiful bike corral outside is because of the feedback from this board. So I would just encourage everybody, if you have feedback like that, please let us know. We are extremely open to that. We want to do the best, not just for the folks living in the site or the staff, but also the folks who are the neighbors. That is really our commitment. And so please, keep us posted on that. And I will say, just because we oversee all of the HRCs in the city, I have spent a lot of time at the cruise terminal over the last couple of weeks. And, if there's specific questions you have about the actual activities and programming in the terminal, I can talk about that. And happy to. And, kind of, if folks are curious.
But we definitely want to stay with the.
I got you. And I appreciate that.
Anything in our district, because that's what's going to concern us the most.
I hear you. But there's a lot of, information travel. And so on the note of the Watson, so when we first opened the Watson, it was exclusively for single adult men in the asylum seeking population. And so what eligibility was pretty simple. Folks had to show us proof that they had papers from Customs and Border Patrol acknowledging that they were applying to seek asylum and were, permitted to cross the border on account of that. Now, there is not necessarily sort of a time period associated with that. The way that the asylum seeking process works is that folks go to the border, appeal for asylum seeking status. They're essentially given parole papers that acknowledge that they have sought this, and then sort of a temporary passage in with a couple of requirements associated with it. So one requirement is that folks have to check in at Federal Plaza to basically acknowledge they are still on the line. And then there are also court dates associated with actual immigration court. That whole process can be a very long and tedious process with all types of complications. And each case is different. Each individual and each family is different. So, part of the work we are doing is to try to think about all of the distinctions and disparities in among each person and their stories. They've all come to this hotel in the city from different means and through different passageways, most of which are fairly harrowing, and we want to be really thoughtful about that. So in terms of the Watson, this is by no means the first family with children site that we have operated. In fact, we already operate two or three others. One at the Stewart, one at the Row. This is our third. So we are pretty experienced at this by now.
And just for people's information, the Stewart is on 32nd and 7th, and the Row is on 8th Avenue and 44th.
Correct. Yeah, the Stewart is right across from Madison Square Garden, is the way I like to think about it. And the Row is our largest hotel. There's over 3,300 people living in it, all families with young children. And so this site, for however large it may get in the end, will definitely not be our largest site. It will be more sort of on trend with probably where the Stewart is. The Stewart has about over 1,000 people, but not near 2,000 people. So one of the things we did in order to make sure that the site was ready was we went through all of the rooms, and this was happening throughout anyway. When we come into a site, we have health and hospital staff who are assigned to the site, and the first thing that they do is go through room by room, checking everything, doing a maintenance check, working with the hotel to repair things. We want to make sure that nobody's walking into a unit that has, no heat or a leaky faucet or, kind of some structural issue. So we went through, made sure that, the units were ready to be lived in, and then also tried to retrofit. So each family is going to have a different composition. At minimum, the families at the Watson are going to have one adult and one child under the age of 18. And so thinking about that, what should we do with the mattresses? How should they be placed? Will we need pack and plays? So really trying to build out that basic foundation. And then as people come in, the way the hotel is set up, and it's been set up like this from the beginning, but you know, it's a really important part of intake with families, especially when there's single adults coming in, they're assigned a bed, and unless they have a special accommodation, it's a pretty straightforward process. With families, it can be different because family compositions will change. So one of the things we do upon intake is try to understand what are the kind of spatial needs of the family. Is it a family of 4? Because that's a different, you know, need than a family of 6. And so then we look to the rooms, you know, we can play a little bit of Tetris, trying to figure out where folks should go, which rooms are ready. We can add and take away as needed in terms of, you know, beds. We have pack and plays. We have supply rooms that have, you know, kind of unlimited diapers, baby formula, everything you can need to support the youngest of our guests. We also have 24/7 clinical care. This is built into all HRCs, regardless of population. So this is really critical to us. We're a public hospital system. Nothing is more important to us than that folks are able to receive immediate and constant medical care. So folks go through intake. Sites with children have vaccination teams on site. We have done a lot to really expand the vaccination presence because we want kids to be able to get it to go to school as soon as possible. And obviously to go to school, they must be vaccinated, which we love. We think that's fantastic. We want to make sure we're meeting that mandate. So, you know, we begin to assess sort of immediate medical issues that may arise. People have been on long journeys. Perhaps they have a chronic condition. They've lost their medicine somewhere. We'll make sure that they have all of that. People can identify if they, you know, require certain diets, like a diabetic diet. All of our food is halal to make sure that we can meet, you know, other restrictions on the way folks are eating. And so we really try to be thoughtful about all of that. And if there are issues identified that can't be treated immediately in the HRC, then the advantage of being the hospital system is we can refer folks into the broader healthcare apparatus. Most people who are coming through, if not all, are eligible for emergency Medicaid. So we also make sure they get signed up for Medicaid. We have Metro Health Plus on site. They're able to get folks enrolled really quickly. The power of primary care is, you know, looms heavy here. Obviously, we want people to have emergency care, but if you can go to a primary care physician, get your care coordinated, then, you know, it's a much better process. Nobody wants to end up in the ER. So, you know, we really try to make sure people are connected to those parts of our system as quickly as possible and as much as they may need. Then folks are given a room assignment. It's just like a hotel. They're given a key. They're also given a badge. Everybody has a photo on their badge and then a QR code. We don't have any other distinguishing information on it. And folks scan in and out as they come. They come and go. There's no curfew. These are all the same rules in the previous population as well. No curfew, but we also have a no visitor policy. We want to make sure that the folks who are coming in and out live there and work there. So then once people get their room assignment, they go to their room, they're able to settle down, take a shower, have a meal, make sure that, you know, they have sort of the basic things they need to get their bearings. Again, there are people who have been through just horrific journeys, and even just being able to sit somewhere for a couple of hours and, you know, sort of decompress goes a long way. So that's kind of phase 1. And then phase 2 is really thinking about, is somebody going to stay? Is a family going to stay? And if so, what are the supports that they need? And if they're not going to stay, what are the supports that they need? So in terms of folks who have other next destinations, this is not the end of their journey. We have reconnection services built into all of our HRCs. Folks can at any point say, you know, I want to try to contact a family member or a friend and see if I can arrange to stay with them. That people are located all throughout the country. As soon as they make a connection, they can let us know, and we're happy to help them reticket. So we'll reticket folks, you know, Michigan, Chicago, you name it, we'll do it. I will say, I know there's been a lot of talk about Canada. We have never reticketed anyone to Canada. So something interesting that you may want to compare to what you've read. And we don't advise people about where to go, right? For us, it's about the guests telling us where they want to be. Where does their journey end? And, you know, that's the important part here. So wherever they say, this is, I think, going to be where I stop. We want to make sure they get there. We want to support them in that. So reticketing is built in, whatever it is, planes, trains, automobiles, we'll purchase the ticket for the whole family and make sure that folks get there. There are folks that just choose to leave also and don't necessarily disclose where they're going. That's fine. A lot of the time we only know because we've purchased the ticket. But that's sort of true across all systems, DHS as well. For folks who don't have that immediate connection to or reunification plan, some people, it will take a while for them to develop and then they will choose to move on through the system. For other folks, that's not really an option. So for those folks, we want to make sure that they have access to everything New York City has to offer, all of our amazing services as quickly as possible. So, we've talked about Metro Health Plus and Medicaid. Something that's really important for family sites is that we have DOE present, DOE Enrollment Office staff present, basically from day one. They may not be there 5 days a week, but they will be there making sure that kids who are school age are getting enrolled in school ASAP. And they've done incredible work. If you should go by the row in the morning, you will see school bus after school bus of kids getting on, excited to go to school. It's an amazing experience to just see, the children are coming into our sites. They have been through the same journeys that their parents have. They have seen some pretty indescribable things. And to just see the kind of joy on their faces when the school bus arrives or when they know that they're going to school and their friends are there and they have this new community, it's incredible. We're extremely proud of that. So as soon as folks, express that they are going to stay, to the enrollment office they go, kids are enrolled in school, vaccinations are able to be performed on site. There are folks who may have been vaccinated previously but don't have a record. We will still vaccinate them. There are folks who have no record. They're definitely getting vaccinated. I will say that this is probably one of those vaccinated populations in New York City. People are very excited about the opportunity to prevent these terrible diseases, and we are happy to make sure that they can. So that's kind of the top line of the services offered. I'm sure there's other things I'm missing, but those are the basics, and happy to answer questions. In terms of, I know population was a question. So I think there's about 400 units in the Watson. The way that was divided in the previous population, there would be no more than 2 people per room. So the ceiling was basically 800. In this case, with families,
there's 600.
Oh, 600. Sorry. So then the ceiling would be 1,200. Sorry. In this population, same amount of rooms, but obviously there's going to probably be 3 or 4 people per room. So the ceiling will be higher in terms of capacity, just because more people are staying in one room. And then there's also for much bigger families, there may be other options of kind of like a suite, depending on how the hotel is structured. So right now we have just over 250 units, which is about 870 people. So we'll continue to grow that. I think if you leave this conversation with anything, I would say 2 things. One, just the incredible resources that are being offered all in one place. That is really like the beauty of the HERC vision, is that everything can be in one place. We want to put as many services in as possible. But the other thing is just how intense the need is. This hotel has only been serving families for a couple of weeks, and it's already at this capacity. So, I think it's a really important part of this discussion that when we talk about how intense the need is and how many people are looking to receive services, it's really a staggering number.
I'm going to go to Dolores, but 3 questions on information. First, for Department of Education, we know we don't have any school seats left. So where are children being sent to? Because our schools are now at capacity. Second is outdoor space. We talked about this prior. And now that you have children, we seriously need some sort of outdoor space figured out. And the third is smoking, which we figured out smoking within that sort of driveway area, but now there's more people again. So if you can try to address those, and then Dolores, followed by Josephine.
Yeah. So on DOE, and really, I would recommend asking them. I don't mean to, kind of kick it over to them, but they are truly the experts. Their staff literally come with rolls of attendance and sit there seat by seat and assign people out. They may not be going to the closest school possible, but they try to get folks as close as possible to the site. And we arrange for school buses to arrive if if there's any distance. But, yeah, we acknowledge that's sort of part of the experience. But there is certainly capacity in certain places, and people are not all the same ages, right? The kids are all over the place in terms of ages. So that's part one. Part two, on outdoor space, I think one of the advantages of the Watson that other hotels don't necessarily have is that there are common areas, so that folks can not just have services there, but we can also use them for other types of programming. And so more and more, we're trying to think through what is programming that we can bring in to engage folks. But yeah, it's understood on outdoor space, and we will see. We will see what we can do there. And smoking, I don't think the smoking policy's changed. I will say I think we tend to see less smoking in the family population.
Okay. Dolores, followed by Josephine.
Hi, so I apologize, I was late. I just want to confirm you are an agency of the city?
H&H, we're not actually technically an agency, we're a corporation.
You're a corporation.
But controlled by the city.
But controlled by the
we
city.
we have a board, yeah.
So I'm really excited about your model. So happy to see that there's a model that exists that is being put in place. And this comment is not for you. This comment is more just, I want to be on record. So happy that this is in place. My question is, why haven't we been able to figure out how to put this in place for the people that have been in our system that are in DHS for all this time? So it's great that we're welcoming of folks that are coming into our country through really terrible means and reasons, but why can't we figure out how to roll out the same model for the folks that have been here and that don't get the 360 services that you talked about, with 100% that focus on the health, which I think we desperately need for so many of the people that are in our shelter systems currently.
Yeah, and I mean, I don't want to speak on DHS's behalf, but I do want to bring 2 points forward. One, that DHS has a little bit of a different goal, right? Their goal is to try to connect people to permanent housing. One of the things we're trying to solve for in our system is that most folks are not going to be eligible for a lot of those programs. So inherently, we are kind of, we have to work around that. And so I think it's important to acknowledge that difference. I would also say that, this is something that the mayor put in his state of the city, drawing attention to folks in the shelter system having a more direct pathway into healthcare. And so, I think in that sense, you've hit the nail on the head that there is certainly renewed interest and understanding of how critical this connection is.
Josephine?
Hi, Laura. Thank you so much for being here. 3 quick questions. The first is, are you offering, are there bilingual social workers there for the adults and the children? We have no bilingual social workers in our schools at all, so that's a huge issue. That's one. You said that you give vaccinations on site. Is there any way that children from other, say, DHS shelters can be vaccinated at your location? Because kids are showing up at schools with the measles, and it's very complicated for schools to have to track down where these families can get vaccinated. And then the third thing was that, are you offering any English language classes for the adults at that location?
Yeah, so let me take the last question first. English language classes are a #1 request from adults at all sites. It has been a huge priority for us to try to work through how we can incorporate it in. We've been talking with DYCD, who runs a lot of the adult learning programs. The advantage, I will say, in the family sites that single adults don't have is that kids are coming back with homework in school, and they're kind of getting to learn alongside the kids. It's a huge advantage. Whereas single adults who are coming here, a lot of them are working, but they're still not really able to master the language. It's a huge disadvantage. And so I hear you on that point. This is something that, like, every day I am trying to figure out how we can leverage, the programs that we have. We've encouraged people to use We Speak, which is Moya's TV program for learning English. Unfortunately, it's not really for beginners. It's for more kind of moderate level learners. But yes, this is a huge concern. And again, we hear it universally. It's not specific to families with children. In terms of vaccinations, right now it's a service we're only offering to folks in the HERC. Kind of like most of the services in the HERC, they're pretty specific to the population. But DHS should have a way to refer people into like FQHCs and H&H even if they need to. So I would recommend following up with them about that.
They don't, Laura. That's a problem.
Okay.
Like it's not working. And Josephine brings up is it creates a problem with the schools because then the schools are dealing with kids who are not vaccinated. I mean, considering that you're local and we have so many other DHS shelters local, could we ask you to follow up with Jesse to see if the good work that you do at HHHC could actually help get these DHS shelter kids also vaccinated? So your site is local.
I would just say this though, just a little bit like it's not an unlimited program in terms of capacity. When you go to any vaccination room in a HERC, they are packed, right? They're vaccinating, they're doing like hundreds of 100 vaccinations a day or so. It's not kind of as unlimited as we might like it to be. So I would just be a little bit cautious about kind of thinking through, adding more people into the queue. And also a lot of these vaccinations, as folks know, they're multi-shot. They take months to complete the series. So it's not a one and done. Folks will have to come back multiple times. And so it does create it's unfortunately not a system without limitation.
I will leave this with this thought for you and I'll go to Aurora. It's a resource we have in our community we didn't have before. There's another vulnerable population handled by another agency. We're all one city to coordinate something. If we can get a bike corral, we probably can figure out a way to get vaccinations for kids in DHS shelters, right? Because you're the right agency to do it. That's all.
Yeah, and DOH is also a part of it too. There's other folks here, Joe, just to give them a little bit of credit.
But obviously they're not working. So Aurora, you're next, followed by Katie.
No, sorry. Josephine had one more question.
Oh, sorry, Josephine, I apologize.
It was about caseworkers and social workers. So we do have social workers. They're not as many, I think, as anybody agrees that we need. We have caseworkers though, and I should say bilingual staff are really important to the model. So like over 90% of our frontline staff are bilingual. Now, at this point, we also have folks who speak languages other than Spanish, right? In the beginning, pretty much everybody was a Spanish speaker. We now have folks who speak Haitian Creole, Wolof, Portuguese, Ukrainian. And so we also have some staff who speak those languages, but we also have Language Line, which is, the service that H&H uses within its own facilities also to communicate with folks. So, we do understand that when you can't communicate with people because of a language barrier, it makes the work much more challenging. But that said, we do have the caseworkers who try to help navigate folks through the services. And there is access to social workers. It's just that it's not as there are more people than there are social workers by far.
Aurora?
Okay, thanks.
Thank you so much for everything that you've said, and I'm so sorry for being late. I just had two questions for you. So you talked about the DOE being present and school-age children going to school and being bused out. But I'm wondering what's happening with like the younger school-age children, like the 3K and 4K. Are you able to send them to like Head Start programs? Because I know that could be really helpful, I guess, to parents for employment. And then the other question I had was, what kind of resources are we offering to parents as far as what they should be expecting for their children, as far as attendance, like what the expectation is for school?
Yeah, so schools do a lot of that education with parents and work with the parents. And, I think we would look to them as kind of the experts on a lot of that. But in terms of the younger students, or the younger children, this is definitely something we've been trying to think through. It is a challenge for kids that are not school aged. And, we know that people are working. We know that people need to be able to, leave. And it would be great if there could be supervision for the kids. We are trying to work through what could be done there. But it definitely remains a challenge that we're trying to resolve. And I don't think the DOE enrollment staff are working with 3-year-olds so much.
Well, I think my question really is about like, could we offer services to Head Start programs? Because all the parents could qualify for Head Start programs. And also, I don't know how much the schools not that they don't want to, but it's kind of hard to kind of give individual parents as children are rolling in weekly or even monthly. So is there a way for the shelter themselves to provide just a general intake of this is the expectation for schools?
I think I need to understand more about what you mean.
Just a general, like, brief, like, as a New York City parent, like, I know if my child misses 18 days of school, right, this is an automatic reason for them to be held back, right? 3 latenesses equals an absence. This is also, what are the expectations for a reasonable absence? What is an excused absence? What is an unexcused absence? These things kind of need to be we need to kind of go through these things, as these are not as simple, I think, as we kind of live here and we kind of know the expectations.
We understand it. We understand it.
Yeah, we
right.
live these things, right? But when you're coming in from anywhere, even a different state, that might not be the case, especially with a different climate, right? So if you think it's just really cold outside, that might not be a reason to not send your child to school.
Yeah, I mean, I'm going to say, I think that people are really excited to send their kids to school in general, right? I think that there is a large desire to make sure that attendance is as high as possible. But, you know, I can take the feedback back to folks and see what they think. I know that, you know, we've done education sort of like units around different things. We may have engaged DOE, and also Students of Temporary Housing also has staff that are there and can talk through a lot of these as well.
Yeah, I think that would just be great, like a general, like, these are the expectations of like what qualifies for expectations for school. That could be helpful. Thank you.
Thanks for Katie, followed by Roberta.
Hi, thanks for the presentation. Actually, on the other subcommittee I serve on as part of our community board, we have discussed with some of the folks involved with students in temporary housing, how they are providing supports and things in the shelters. Now, I don't obviously know who's assigned to your HERC, but they did tell us that the great thing is that they're trying to work with the families and being somewhat flexible, you know, and not and understanding, as you said, that they've gone through such trauma that maybe the absentee stuff might be a little higher than usual, you know, but they're not reporting families, you know, they're really just trying to encourage them. So I'm sure if you talk to the DOE rep, you could probably get some great information for us about sort of how he or they are, you know, what services they're providing, which would be lovely. But I had a couple quick questions. One is, you had said that right now there are about 250 rooms that are full, and out of 600. And I just wondered if you have a sense from the way people are coming into the city or the rate at which they're coming into the city. Do you have a sense of like when and if you expect this to be full?
Oh, we definitely expect it to be full. I mean,
say it again?
We definitely expect it to be
That's
full.
what I figured, yeah.
I don't know when it will be full. I don't think we have a projection for when, but there are people coming in every day, and not small numbers of people, not in the hundreds, but there are definitely new families coming in all the time. How are people getting here? It's really all over the place. In the beginning, it was definitely the chartered buses when people didn't necessarily know where they were going, didn't necessarily know, you know, what was going to happen when they stepped off of the bus. That is less so the case now, but there are still people who are being given tickets and told to come to New York City. It may not be through certain like state governments on the southern border. It may be through CBOs. It may be through other kind of organizers and advocates who have explained to people that there are not very many resources for them in other places. So we certainly see a lot of that. You know, we also have come to learn that there were folks that were here already before the buses started coming who didn't know how to sort of access any of the networks that we have set up now. And now that they're set up, this kind of population has become connected. And so, you know, there's people coming in through that route as well, through local advocates that were already here. That's a part of the story.
Laura, how many families are leaving on a given week. So get some idea of, like you said, it's part of their journey, part of the stop. Like, what's the sort of turnover so we get some sense of it? I mean, not exact, you know.
Yeah, the turnover is lower in families than it is with single adults, obviously because of household size, right? It's a lot harder to, you know, reunify 6 people with somebody than 1 person. We have a pretty good rate of people resettling in single adults. It's lower in families. It's all over the place. Each case is different. And, you know, I also think length of stay varies too. There are some people who have traveled here, haven't been able to contact their families in, let's say, 2 months, and we've heard stories like this. They've come into the HERC, they've been able to call home, and they hear from somebody saying, yeah, I'm coming in 2 weeks and I have a plan for us. They had no idea. So really each story is quite different. You know, I think it's every week there will be a different sort of perspective on, you know, what the churn has been, how many people have come in, what the length of stay is.
Can you give us just a rough idea, for example, out of there's 250 now, have they all been there for a long time?
No.
We're trying to understand how the system works, that's all.
I understand. It's hard for me to describe it because like every single day and every week, it's a bit of a different story. You know, for instance, like the Watson, right? When it was all men, there are like almost 700 people who moved over to the ferry terminal from there. So even in that move, there were still people who were churning in and out and people who were staying. So it's just incredibly challenging to quantify. I'm trying to give you the best sort of description of it that I can. Again, with families, there's some families that come in and say, I just needed a place to stay for a week. And then we know we're going to San Diego. And for some families, you know, it's like the whole goal was to just sort of, you know, flee where they were. And I don't think there was much thought sort of given to what would be next.
So thanks for that. I just had one last question. When we spoke with the person who deals with students in temporary housing from the DOE, she said that because the DOE's primary goal for students in these families of asylum seekers is to put them in schools that are dual language. And because of that, they're usually not very close to the shelters. And as a result, most of the kids are getting on buses to go to school. And because they're being bused to school, that means at the end of the day, they have to get on the buses and come back home again. They can't stay for after-school programs or for language programs. So they were saying that actually it would be a great idea. And they really hoped that maybe in some of the facilities themselves, that there could be tutors and language programs for both the children and the adults. And in fact, tomorrow we're having a discussion, some of us from the subcommittee with somebody from the mayor's office about this very thing. And I was just wondering, from your perspective, would this be something that you all would be open to at the HERC? And do you think you have, like, I don't know, a room or a space where language and other forms of tutoring could be provided?
Yeah, and this is, you know, similar to what I was saying on the adult English language classes end. Yes, we are desperate to bring these services in. That it doesn't mean that H&H is necessarily the best vehicle for bringing it in. We're happy to provide the space. We're happy to provide
the space and the management, because if they can be brought into the mayor's office, other agencies, it's the coordination.
Right. And
I
saw the letter that you all wrote, and you know, I think I will say though on the busing thing, I think it's a little bit more nuanced. Like, people are not being bused out of borough. I don't think they're being bused necessarily that far away. It just may be not in an immediate walking distance. So
I know at least one of the programs that we heard about was, like, I think up on 110th Street or something. So that is actually, you know, it's certainly not out of borough, but it is
not walkable.
Understood. But all I'm saying is I just want to throw like a little bit of nuance on what distance is. And I'll just say this, I'm from the Upper West Side. I grew up there. I went to school there my whole life. I spent an hour and a half commuting every day to high school and back. So like, I understand, I have a lot of sympathy for the commuter point on schools. I'm totally there with you all. You know, I also used to take the bus when I was a kid down to 72nd Street from 100th. So I get it. I just again, like I when I hear a lot of terms getting thrown around, like people are traveling a long way, I just want to be very clear about what we actually are talking about here, because I think the pictures that gets painted can be a little bit different. But all of that is to say, yeah, whatever services people want to bring in and they have a structure and a budget and, you know, folks who are certified to do it, we want that. But we want to provide the most services possible.
Let's go to Roberta. Katie? Sorry, thank you, Katie. Roberta?
Sure. I just wanted to ask quickly about staffing, and specifically if you were experiencing any challenges relating to staffing, and if so, where, and then if you have the staff to increase the number of beds to the capacity of the Watson.
Yeah, the staffing it's a very staffing intensive model. There are a lot of staff. So, you know, there's a lot of staff sort of on the ground floor, there's security, there's people who are in charge of food, there's people who are in charge of intake, there's people who are running the medical services.
It feels like a well-run hospital when you walk in there.
Joe's been in it, so
Yeah, it feels like a well-run hospital.
Don't take my word for it. But
No.
yeah, and then each floor also typically has staff on it as well. So the staffing has not been an issue for us.
I saw that Jessica Chait had her
Yeah.
hand up. I don't know
Yeah,
if she wanted to
Jessica.
ask a question.
If you can speak, yeah, go ahead, Jessica.
No, thank you. Sorry, no, thank you. It was actually, I mean, I would make a comment, which is just that 3,300 in the district at a different hotel is just a tremendous number. And as this
I think we lost Jessica.
Really.
You broken up, Jessica, badly, but I think she said it's the number and capacity for the district to manage that. That's why we're concerned about it. Aurora,
Right.
followed by JD.
I would say the rows in District 2, though, just FYI.
Right, but
It's District 5,
The row?
isn't it? Isn't
Oh,
that 5?
Row is District 2.
no, she means Maria's saying community district.
Oh, I'm
You're
sorry.
talking about school
I thought you were
district.
talking about school district.
Yeah, I know. Yeah,
School
yeah.
District 2, Community Board 5. That's
Yes.
what I was thinking.
But yes, they're also in Community Board 5.
No. Aurora, followed by JD.
I was just going to make a comment, and I just want to say, you know, obviously I've heard so many wonderful things about the Watson, and I appreciate everything that you've been saying, but just to put into a little bit of perspective, like it sounds like you grew up here, and as somebody who also grew up here, traveling isn't a big distance when you're talking about going to 110th Street. But as a parent, when I think about my child being such a far distance and not knowing the community, not knowing a country, that is a big distance. And just putting that into some type of framework when we talk about like how far their kids are going and not knowing even how to commute there on their own. So yeah, it is a little bit of a big distance when I think about it.
Well, but I would say to that as well. I think one of the things that we've seen in the family sites that's amazing is that as soon as kids are enrolled in school, families do have a community that can develop much more quickly. Whereas with single adults, like this was a challenge we used to talk about all the time, is like, how can we get networks in here to really create inclusion? You know, and I think one of the great advantages of the cruise terminal is that there's a mutual aid right down the block that does amazing work, really making people feel comfortable and, you know, kind of integrated into their community. And so, you know, I totally understood that, you know, people are adjusting to everything. There's a lot of adjustment going on. And that's why we made sure to have school buses. I mean, honestly, even if people are not going to 110th Street, even if people are going 10 blocks, they may have a school bus.
JD?
Yeah, thanks. Laura, you're doing a fantastic job. Congratulations. It's very difficult, but all I'm hearing tonight is about the wonderful model that you have, and that's terrific. However, I'm a member of the community board, so I need to ask you about the community that's already here. So when you come in, do you assess what we have here in terms of schools, in terms of parks, in terms of clinics? Is that part of your planning? First of all. Secondly, do you work with the Ryan Clinic? Do you work with Mount Sinai, which is sort of across the street? Is that part of your model? Secondly, the folks who already live residentially on that street, how is that working out with all the food deliveries, all the change of population? Do you communicate with those residents that are nearby? And how does that work out? So again, not to criticize what you're doing because it's fantastic, but I have heard nothing about the larger community and bringing in more and more folks. How does that work out?
Yeah. And then I will tell you, I did have a hard stop at 7:15. I'm going to actually enforce it now.
Thank you, Laura.
But unless there's just one more question from Maria. But that's
Maria
okay.
gets definitely a question, Laura.
Okay. All right. So let's start from let's go backward. On community sort of outreach engagement, we created an email address specifically for the Watson so that folks could write in whenever they had concerns. We don't even have that for the other HERCs. And you know, I don't know how often it was used. Honestly, it seems like it was a pretty, you know, mellow mailbox, but we wanted people to feel that they could alert us to any issues that were happening in real time and they could get a response. You know, folks also come to me directly. I hear from the community board, from council members' offices, from other elected offices, and we would try to get answers as quickly as possible. You know, I know there were issues around music volume and whatnot. There were issues around the e-bikes. All of that feedback, we really tried to figure out how to manage through.
And you did.
Thank you, Joe. Much
Good.
appreciated. And so, you know, that's sort of the piece in terms of making sure that there is that conversation loop. In terms of kind of assessing the larger sort of community or resources, I mean, ideally, yeah, all of these things would be considered, but the truth is that, you know, we are bursting at the seams population-wise, right? The reason that we moved this hotel population to families with children is because we have so many families with children.
Mm-hmm.
You know, we already had probably 4,000 or 5,000 families with children in our sites already, and we still needed more capacity. So, you know, there is an element of sort of trying to meet the challenge that often makes it more difficult to necessarily assess every single thing that you might want to do. Now, I will say that definitely school volume is something that I have advocated for, that DOE has advocated for, in terms of thinking through where we are putting sites. For instance, the next Family with Children site that we are opening is going to be in Long Island City and Queens. So, you know, there is definitely attention to that. But there is also the reality that where we can find space, where we can find hotels, all tends to be in a pretty close place, right? It's all proximal. And so the need for hotel space is really driving a lot of this.
Laura, thanks.
That's
Got
it.
it.
Laura,
Go ahead, Maria.
all right. Short and sweet. I have been mindful of time since 7:17. So I just wanted to ask you, I visited before when it was a single men's site, and I know that they were testing people for COVID when they first entered. And when I was there, they had like 2 caseworkers for the building. And so I'm just curious if those things are still the same or if there's something different.
We definitely test for COVID when people come in, and people can get tested whenever they need to, whenever they want to, if they're symptomatic, if, you know, it's available. The same folks who ran the test in Treat Corps are now running this. So COVID prevention and management is very important. We have isolation facilities at all of our sites. So there are units that are set aside in case people need to isolate, should they have any kind of, you know, virus or illness that would mandate that, and they would be able to get wraparound services, but also not expose themselves to others. And then, and it's also true at the cruise terminal where it is congregate, but we have trailers for isolation as well. So it's.
And what about the caseworkers at the site?
The caseworkers, I have to
How
check.
many?
I would assume there are more now. But I have to check back on
You can
that.
get back to us
And,
about that.
and I
right?
just want to tell you, Laura, I've worked in a family shelter and visited other family shelters in this community, and it was a very different feeling being there. And it was impressive. Even just sitting, like going to the cafeteria and seeing what people were being fed and the way it looked. It was just, yeah, it was pretty remarkable, very different.
We certainly try, and I really appreciate you guys. If you have specific feedbacks, things that you want us to look at, issues, please let us know.
Open space.
Open space. I mean,
whatever you can do.
We will try. We will try. There's nothing we won't try. I will say there are many other agencies in New York City.
I know. Thank you so much for being here.
Yeah, thank you very much. And just one thing to get back to us on. Number one, the number of caseworkers that Maria brought up. Number two, I'm going to ask you to get back to us. Don't tell us now. When families are not able to move on or connect with anybody else, what happens to those families? In other words, they're in a process, but there are certain people who don't have relatives, friends, whatever. I know you don't have an answer yet, but just
no, well, for now they stay with us. I mean, we do
I know, but
it now.
we're talking.
Well, that's the question. Yeah.
Right. So if you can, we can talk about that further. And I thank you again for coming tonight. And I think you're going to get a very short letter from us just talking about open space, the school seats issue to make sure this gets worked with, after school programs, and request about vaccinations. I think that those are like the 4 items that make sense to say, can you help us with the DHS shelters? Thank you, Laura, for coming tonight.
Thank you. I'm sure I'll hear from you all soon. Have a great night, everyone.
Good night.
Bye.
So let me just go through this again, just quick bullets. Does everyone agree we're asking about this vaccination thing to see if they can help DHS with the vaccination at this location? Yes.
Joe, on the same vein
Yeah.
of that question, and this is something I wanted to ask the rest of the committee, whether or not it's appropriate to, writing to them, is that broader comment that I made about the fact that we have this very specific program for a population that's just arriving. And even though the goals of the 2 agencies are different, what we're missing is the fact that we have populations already that need these same services. So don't know whether or not the broader community thinks that it should be included in the letter, or whether that's something we take up as a different conversation to DHS.
I'm wondering, Katie, go ahead. Sorry.
To that point, Dolores, I think we might need some more information, because I do know, certainly there were at several sites that I know of, there were COVID vaccinations being offered and a variety of other vaccinations being offered, and I think they still are. So anyway, I guess before we may just want to find out who we can ask to get specifics about what is being offered by DHS.
I meant more broadly to say we're really excited about this model. We think this is a great model, and ask the question, is there an opportunity for having a similar model, which seems to be successful for our DHS population?
So I guess my point is, I think the same model is in place in certain places already, and so I guess so. It sounds like we're assuming that it's not anywhere.
No, yeah, I have to say that this vaccination issue was raised by Josephine, that the schools are having an issue. I think we should address it, because clearly, whether it exists or not, Katie, it's not necessarily happening always, because we know the DHS shelters are not as well managed as this one here. And I just think the distinction here is this is health and hospitals that can actually administer, right? It's not like you have to go someplace else. So
but at some of them, they are being administered. And all I'm saying is, yes, it's a great idea, but let's not assume it's not happening everywhere.
I'm not going to say, okay, I want to say again, no one's assuming. It's been reported by a committee member that it's a problem with the schools. So we want to say, can we use this as a resource? That's the request, right? So
if it's not happening in certain places, then can we have it? Yes, that's all.
Right. We're not saying you're not doing it. We're saying that's our question. The next thing is we heard, and you brought this up, Katie, the issue of the after school programs and tutors, and to accommodate them there and to coordinate. I think that's a very good thing, and looks like it's on the way already, but it's to coordinate. And then the third is open space. Now go to Roberta, followed by Josephine, on just points that we would write on this.
Oh, I just wanted to clarify that what Dolores is referring to is the overall model, and just to note in the letter that there would be, what you're asking about is if there are opportunities to offer the same model to larger populations, because we've seen it to be so successful, that we would welcome that. That's kind of what it sounded like we're talking about vaccines and then also this, and those are two separate things. I just wanted
Dolores,
to
clarify, please.
Yeah, I did mean the broader, but I'm happy to narrow it to just the vaccines, as that's a very specific ask. But Roberta is correct. My comment was broadly about the fact that we have a program here that seems to be working, and it's been applied to folks that are coming new into our community that are unhoused, and questioning whether or not we have an opportunity to broaden that model for those that have been unhoused and in our DHS systems for years.
Right. In other words, I think, Roberta, the ask is, can some of these practices that HHC does be applied to some of our DHS locations? Because we know they vary so wildly in their ability to, right? Isn't that it? That's the general, yeah, I'm getting a nod, yeah. Right, okay.
It sounds like that it's just two separate things. It's
Right.
one about the vaccines and then the other about the general model, which I think is in line with what the committee has discussed.
Josephine?
I just wanted to give a little background context because I think it's important, this point that Dolores has brought up, and these are conversations now that I've had with 3 principals, and it has become really the tale of 2 different shelter systems, and one is very inequitable compared to the other. And so it's not just the vaccinations, but what's basically happened is that the populations that were here before in our schools were moved out of the hotels, moved to other areas of the city. And then the new families came in, and what happened was the schools lost their social workers that were there, the Bridging the Gap social workers from the DOE that were here to take care of the kids because the other families moved out. So now we have no social workers there. But the point that I'm trying to make is that the families that were already here that were making some progress had to leave, right, for these new families to move in, and it's very unfortunate. So I guess the point is that if we have any opportunity to say that this seems to be working, this other shelter system, and to use that as a model for these the DHS shelters, then we should go ahead and use that opportunity. And I also wanted to say that I understand the situation with the busing and how it would be great if all the kids could go to our local schools, but our schools are at maximum capacity. I reached out to 5 of our schools. They have all received upwards of 100, some 130 kids in the last 2 months. We have teachers that are crying under enormous stress, and the kids who needed extra support before are now not getting it because so much attention has to be paid to the other students. Our classes are a size 33 kids per class now, and an average elementary school size class in the city should be 25, and they're at 33. So we are literally just over capacity. So if a child has to be bused to 116th Street, then it's unfortunate, but that's kind of what's happening. We just can't afford to have more kids in these schools.
It's a reality about our number of school seats. We've hit our max. That's the thing, period. Right. Maria, take over.
All right, so yeah, go ahead. JD?
Can we put in the letter that we applaud their continuing outreach to the local community and their attempts to resolve any issues? I think that's great. And also Josephine's issue about assessing the local school needs when they plan this sort of thing, something like that. But anyway, thanking them for reaching out.
All right, I wrote 2 of the 3 things you said: applauding, reaching out to the community. I missed the second thing and I got the third.
And resolving issues, local issues.
Yeah, they did a really good job with that, and they were so open. Resolving local issues. I had my hand up. Well, I'll let Aurora, you go first, and then I'll ask my question. Go ahead. Aurora, you're on mute.
Thank you, Maria. Sorry, I lowered my hand, but I didn't unmute myself. So I just wanted to echo what JD said, because this was the first agency I actually heard say, give us like a clear, concise answer of where they were going to open another shelter, and that was like amazing. I couldn't believe what I was hearing. So I really wanted to like emphasize that. And as far as like the schools, just to Josephine's point, yeah, I agree. Like we can't take any more students. 33 is the capacity after second grade. Before second grade, it is 25. I think the point I was trying to make with that was just that let's not dismiss that that's really hard though for parents to not know where to navigate. So we shouldn't dismiss that.
Yeah, I hear that. Not minimize that at all. Joe, you're back, and actually I put my hand up because I wanted to just clarify something, because I thought Roberta actually made a good point, and I just want to make sure that in the letter what we're suggesting, and I heard Dolores say it would be just about the vaccines, right?
No, it's both.
But okay, because I was gonna say, okay, because
No,
I was gonna say I
think
it needs to be both.
I agree too. I just wasn't going to go ahead and have a long drawn out fight, which we tend to have in this committee, where we get to the nitty gritty trying to get to perfect. And so I just wanted to ensure that we actually get a good assessment of our sentiment and not be bogged down by real specifics that maybe a couple people don't agree with.
So I want to note, I think tonight on this particular item, first of all, we're in agreement this is a good model. So that starts us off together in a great spot, right?
Yes.
And our first ask is going to be, let's take this model and apply it to some other DHS shelters in our district so they can be as well run. We'll say that just like flat out. Then we're going to specifically note, though, because it's HHC, that we'd like them to open up their vaccination clinic to occupants of other DHS run shelters to try to get the vaccinations done for school purposes, right? That's a general thing. We're going to talk about the after school and tutors space and coordinate with other efforts from other city agencies. I asked them to come up with some open space and get back to us on that. That their outreach efforts to the community have been good, and they've resolved problems. They want to continue to resolve problems. And then I'm going to put the note that Josephine noted about the schools at capacity with the class sizes at 33. So, and Josephine, that's in how many schools now? Because I want to make sure we don't.
It's in at least 3.
At least 3. Okay.
Right.
Because I think just giving us that it's in our district in at least 3 schools, that's what it is. So, going to Sabrina, who hasn't spoken yet.
Yes, just going back to Dolores' point. So I guess what we're referring is that they're a good model as a vendor. Right, because I think HHHC is very different than DHS, because HHHC is a corporation, so they're semi-quasi city. They're not really, they have a board. They're not fully controlled by the city.
No, they are. Their board is appointed by the city.
No, funding-wise, no.
Who appoints the board?
It's like not only city, but it's like statewide. So it's like one of those Scooby. It's like it's complicated, but it's a corporation, so it means that not 100% the city has oversight on them.
Right, but it's like the Economic Development Corporation. They're an independent entity, but at the end of the day, they're not an agency.
The city doesn't have 100% oversight on them.
Oh, okay.
So that means, I mean, anyway, I'm not going into the specifics of that. I'm just saying that like is a vendor's thing, right? So it's like we're saying that they as a vendor are providing the greatest model.
They're not a vendor because they don't have a contract. So that's a little bit different. I think they're just an agency that
they have to have a contract. That's something maybe we need to figure it out if they have a contract.
Yeah. HHC is operating the facility directly as part of its charge through the mayor's office. And then they subcontract out certain things at these locations. That I know factually. Like they made it like a program of HHC right now. So listen, I guess you're right. Let's have Jesse do the due diligence to figure out exactly the relationships. That's what we should do. Got it. Sure. Yeah. Because we can talk about it without knowing exactly. It's better we get it clear.
And that's my point, just to do more research.
Right.
Motion to adopt after we have that clarity, meaning motion to adopt that we write the letter.
Second. AD. All those in favor, please raise your hand. Any opposed? Any not present not eligible? Any abstaining? And for the first time, you have no conflict, Sabrina, on this, right? Because they're not part of the city budget. Okay, great. Let's move on to our next item, which is the letter about the Artel. And I'll put it on the screen. Everyone saw this in the Dropbox? Okay, so let me just sort of set the stage a little bit before I put the letter up.
So while you put it on the screen, do you want me to make edits on my end or
No, I'm gonna make the edits live.
Okay.
Yeah,
All right.
I turned it to a Word doc so it's easy to look at again. But again, you're going to see edits. There's 3 different colors. 3 different committee members spoke about this. And I'm also going to go through the letter and try to get to the parts where I believe, first do the parts where I believe we have common ground that is just sort of information, and then leave the things that are a little more discussable, how's that for a word, toward the end. So let me share this first.
And full disclosure, I meant to make additional edits and did not. So I will just speak what I was thinking.
Can everyone see the letter? Now, the letter was sent out
Yes.
without line numbers. I put line numbers on it so we can talk among ourselves and refer easy to this. I'm going to ask everybody when you raise your hand, because the letter's up, we can't see everybody at once. So just sort of make a note if you want to speak, because we can't see all the boxes. So let's go to some, I think toward the bottom part of the letter, some things that are very simple. So this section here, from line 79 to 94. Again, the colors, Katie and Roberta, do you remember what your color is? I'm sorry to ask you that, but I remember.
You've got Katie, Jessica, and
Roberta.
All here. I couldn't tell you only because we edited in different programs, and I think what you ultimately
right, yeah.
I think mine may be blue, or at least some of what I see here is what I put in. So, but you're right.
Right. So you would be able to tell us which ones are what. So
Yeah.
from line 79 to 96, this to me, I think that we will not have a lot of discussion about. Can we just take a moment to read this and then see? We'll vote on this in sections so we can get through it. All right. And if you want to speak to it, let me know. And then all I'm going to do is I'm going to highlight the sections that we've agreed to, and then we'll move on to the next section.
Could I ask that Hogar, is that explained earlier?
Yes, it is.
Okay.
But I'll make a note to make sure it is. In other words, saying what it stands for, right?
Yeah.
Got it.
And I would, because we have an ask at the top of the first paragraph and then more asks in the second paragraph, I would suggest that we just start the second paragraph with, in addition, comma.
Here. Give me the line number, line 94.
Line number 94, just add the words in addition.
Gotcha.
Comma.
Yep.
And then in order to, yeah.
Mm-hmm. So have most folks have a chance to read this one?
Or you
Yes?
just need one more in after, in addition, in order.
Yep.
And Joe, just so you are aware, you do define Hogar earlier in the letter.
Great. So I'll cross it off my list. Thank you.
What does it stand for?
We'll come back to that.
Okay.
It's the name of an organization. So I am sensing that we're good with this paragraph. Can I get some nods? Yes.
Yeah, except capitalize we in line 94.
Hold on a second. I'm going to ask everybody to forget some of that kind of stuff.
Yeah, can we just focus on content?
Content.
I this is like the fact that we're doing editing in live time is a little bit of a waste of board time.
Well, we're doing it and we're going to get through it. Next, lines 97 to 100. These are minor. Yes? Yeah, give me some thumbs up or nods. Okay. Great.
I do have
Sorry.
a question.
Yep.
Line 100, the addition of as they arise. The advisory board would advise, wouldn't you want to limit the advisory board to advise when the issue arises? You want the advisory board to be able to advise beforehand. And so as they arise limits the capacity of the advisory board.
So maybe we just end this with, and that community concerns are addressed.
Addressed is it. Like, I don't think you need the caveat.
Okay. Gotcha.
Would it be helpful if we said as quickly as possible?
No,
Stop.
I just think addressed just like concisely wraps it up.
It's like just declarative, really, right?
Yeah.
Okay. So it looks like we're done with these two paragraphs. Okay. Now let's see if we get. Okay, let's see if we get some stuff up here we can get rid of. Going to the top of the letter. There's very minimal changes here. So I'm assuming from lines 20 to 36, this is merely just editing.
Yeah.
Yes?
And it's all informational.
Yeah, great. Okay. The same thing here in this next paragraph, informational, right?
Yeah.
Okay.
Nope. Can you scroll up just a little?
Yep. I'm just trying to get to the parts that we're not going to argue about. That's all.
Mm-hmm. Okay.
So now I'm going to try to keep going to. Okay. So I think this paragraph, there's no changes. So we can certainly say that's okay. Sorry?
I was going to say the next paragraph, though, I think is relevant if we're going to put in.
Right. I'm just trying to get Maria, getting us down to things we agree to. And then
yes, okay.
Okay, we can go to this. Let me see what else we have here. So I read through it before. Okay, now let's have a discussion about one. Actually, no, here, this is pretty good. Lines 129 to 137, no changes, right? We changed diapers and Pampers. Not a big deal. And then this is sort of a qualification of the portion above. How do people feel about this addition from lines 139 to 142? Yeah, I think it's a good clarification, sort of saying we're frustrated with you, not with the issue. Right? Okay.
Yeah, I think
one at a
I'll
time.
let Dolores first. Go ahead.
So I apologize because I'm not making a lot of comments as I wasn't able to be at the last meeting. However, I did watch. And what evidence do we have to support that this is actually how the community feels?
Well,
I don't recall that was specifically the comments that were coming out of the committee meeting.
But we've been on record, Dolores, in a number of letters saying that we support and welcome asylum seekers. It's actually our board policy. I don't think that's a big stretch. The thing that I think is helpful is that second sentence. And maybe the word is not grievances, but it's sort of like we're frustrated with DHS. It's not about the issue of whether or not asylum seekers are something that we're welcoming.
Then I would suggest, if you're saying it's board's policy, that we're adding that we continue to maintain support.
Right.
We say that in line 130.
Oh, we already do. Okay.
Yeah. So this is sort of.
Oh, you're right. It's right above that. Yeah.
Right. So could I ask for some quick thoughts about a better word than grievances? It's just
Joe, I would
a little too union.
You use issues or concerns or a more neutral word.
Concerns. How about that, folks? Yeah.
Yeah.
Okay. And I'm sorry, it shouldn't be doing this as changes, but okay. So therefore, we're done with this, which is fantastic.
Okay. I was gonna ask, well, because I always aim for short and sweet. If we already said it in line 130, why do we need to say it again in 139 and delete that and move it up? The concerns.
Oh,
laid
I
out
just
in
think,
this letter.
so maybe we need the last sentence.
Yeah,
as a
we already
sentence.
said.
In other words,
we continue to support.
right, we kill this, but this sentence just says, and we make this the part of the paragraph above, yes?
Sure.
Okay. And it won't move for some reason because it was converted from PDF. I'll fix that part later. Now, here we go. I think here we're also in total agreement. This is just clarification. Lines 142 to 147.
Yeah, I thought that sounded good.
Okay, everyone we're good on this? Sort of like just tell us in advance what the hell's going on. Okay. There we go. This whole paragraph here, 151 down to 160 didn't change, so that's fine. Now let's look at this. This one's okay too. There's no changes here. Let's go to lines 162 to 169. Both the additions and the strikeouts. I would say that lines 162 to 165, the new stuff in there, I think everyone's kind of would be in agreement with. Does that make sense to you? Everyone?
Yes.
I'll scroll through it a little bit. Okay. So I will highlight this part. I think the question that we're going to have some discussion about is the strikeouts. So we don't need to worry about the strikeout about the DHS philosophy, right? It's the strikeout about to ensure success of the facilities and shelters, and then the concentration of homeless shelters on multiple blocks. Let's have some discussion about that.
Doesn't it say the same thing of 162 to 165?
The
No.
only thing that's different is the concentration.
Yeah, concentration and public safety concerns.
Well, those are the concerns that have created the problems that we've been hearing for the last 2 years. So why are we not highlighting what our actual issues are? But I have a question about where you highlighted already just above that.
Yes.
To say shelters and social services are not nearly as successful without the thoughtful input support. I don't know that we can equate that is what success is for their mission. So I'm wondering if it makes more sense to say shelter and social services have the opportunity to be more successful with the thoughtful. I mean, again, that's a little wordsmithing, but it's not cause and effect of input with community means success for their mission. And I don't understand why we would strike out any of the next lines, because that is the crux of what we continue to hear from the community, is a concern about the concentration bringing in another element. And that's not specifically the problem with the homeless. It's the problem when there's a concentration, we end up having other things happen in our community because this vulnerable population is so plentiful in one area.
So what if we parse out compromising public safety concerns, right? And we note that with no community input, the ensuing result has been a concentration of social services and homeless shelters on multiple blocks, creating unintended consequences. Is that a clear enough statement for everybody?
What are the blocks and what are the consequences? I know you're like, we've been over this, but like, I think we do need to say them if we are going to say them. And
Yeah.
this may not be the section, but we should say them.
So the concentration is on multiple blocks. We know that, and we don't have to detail where they are because we've been through it in other letters, like 10th Avenue, 2 shelters, one back to the other, one on 42nd Street. We have a whole bunch of right?
Unless we add the map to this letter.
Oh, we can just add the map. There might be how about that, Roberta?
I was wondering, like, could you refer back? You could add the map, or could you refer back to like referencing other letters that you've written?
Oh, we could do that too.
But I think the map would be good to include. So they don't have to go find some other letter or something.
No, but we could,
Another potential issue with the map, and you can let me know if this is off at this point, but I believe it contained a number of temporary sites, and I'm not sure if that were more active following the COVID emergency. I don't know if it's been.
oh, no, they're all gone. There were 3 on 39th that kept persisting wrongly, and we finally got them off the goddamn map. Yeah. No, now actually it's been updated, Roberta, too, with the new openings of the Hercs and everything. And those are now a different category, different color, you know?
Having a
And
map
Yadira-
would be helpful.
Yeah.
Thanks, Roberta. Yadira has her hand up.
Yes, Adira.
Thank you. Thanks. I just wanted to agree with, I love the idea of the map because it's like in your face and pretty like black and white.
Or in color, actually.
Color is even better. Thank you, Joe.
So do you want to refer? Oh, I got 2 more hands
And
raised.
Sabrina.
Sabrina, I'm sorry. I'm trying to.
Sorry, Joe.
Yeah.
I can see the hands, Joe. I'll take care of it.
Thank you. Okay.
I remember asking at the meeting if we had a number on the communities, not ours, but around the 5 boroughs of shelters by community boards or any sort of data that points out
And do you remember the response?
are we in comparison to other communities?
The response was, we don't keep this information by community board. We almost
Right.
flipped out.
Yeah, I remember that, but did we get a number though? Did we get
No, they have not responded. No.
Actually, we put it in the beginning of the letter. It's there.
77, I saw that, but we still don't have, I mean, that's what we have in Hell's Kitchen in Chelsea.
No. That's everywhere.
Oh, that's
Well,
all
For the
around.
asylum seekers.
But that's
Yeah,
just
that's
the
asylum. That's
That's
asylum
asylum.
seeker shelters
Right.
back in December.
Okay,
but
that's
nothing-
around the 5 boroughs and
Right.
and then out of those 77, how many we have in Manhattan? 3. Okay, and then because I think this is very important to have. We need to find a way, and this is something to work with Jesse, where we have numbers of shelters, both asylum seekers and
Yes.
homelessness in the 5 boroughs. Because I think as a data point, I mean, when we talk about concentration, full concentration, and perhaps that was one of the biggest issues that I voted no the last time, I can't have a comparison if I don't know what am I compared to. I can't say it's a high concentration part, even though if I don't see a number.
Right. So let's talk about this.
Again, this is not something that it's I'm not for this letter, but it's something that I think as a committee we need to work with, like as a project to get those numbers.
So let's deal with this for a moment before we go ahead. First, DHS has consistently not given us those numbers ever citywide, right? So that's a problem. We're not going to get it. One thing we do know is what is immediately in our district and what is on a map so we can see how it all works together. And I can just speak to I don't know about the numbers of beds, but the numbers of facilities, you simply do not have these numbers in other community districts.
77. So out of 73 asylum seekers shelters.
No. This is
The overall shelter system.
Yeah, this letter speaks to not just asylum seekers, but also DHS shelters too, and everything all works together. Currently we have, Sabrina, we have the Travel Inn.
Mhm.
We have Skyline, which is partially asylum seekers. We have the Watson.
Mhm.
We have the Artel, and now we have the Econo Lodge on 47th that has just opened.
But don't we also have the WJ?
Oh, and the WJ, sorry, 5. So in all of those, we have been amending the map to try to get caught up to date. So when you put it together, it's not the asylum seekers alone, it's the asylum seeker shelters plus the DHS shelters plus the supportive housing that starts to pull it all together. And I don't think, fortunately for us, we are more sophisticated as a community board. We've been able to map these things. A lot of communities just don't have that ability to do it.
Yeah, and we have 2 more hands. Sabrina, do you have more that you wanted to add?
Yeah, it's just like, to me, I can't have a concentration argument without having numbers, purely as a data perspective, but that's all.
Okay, thank you. Roberta, and then Dolores.
I did want to echo what Sabrina brought up specifically about concentration. I think we've had some version of this conversation, but not knowing and then making the claim, I think makes the argument we're trying to make a little bit muddier. There are things that we do really very strongly understand, that there's clustering on a couple of blocks and that's created unintended consequences, that there are genuine issues. But I believe I've heard Leilani say, like, there are more shelters in East Harlem or something. And maybe DHS is lying. I have no idea. My broad point is we don't know. And I would just want to echo, in a place where we don't know, perhaps it would be best to not use that language and to be specific with what we do understand within our own community.
How about we use this language? I'll highlight it right now.
Clustering.
With no community input, the ensuing result has been a clustering of social services and homeless shelters on multiple blocks, creating unintended consequences. How about we all get behind that?
Good.
So that's what I was just going to say.
Yeah,
Roberta, thank you for using the word clustering, because this argument about no data, about concentration, what we are talking about is not how many actual numbers of facilities are there, but there are massive numbers of actual people in one place that all have some additional needs that created the unintended consequences where people were able to prey on them. So clustering is a wonderful word, Roberta. I think that solves, at least hopefully, some of the concerns by having to compare with other boroughs, because this is exactly what it is. We put too many people in one place. If for folks who have been on the board a long time, when BRC was opening up their shelter in Chelsea, one of the things the community board lobbied for was a smaller number of actual beds, because the concern was the clustering of so many people with that particular need. If they were they had
high service
needs, that would create additional problems for them, for the broader community, and not actually serve to help these folks get stable, to get permanent housing. So clustering is a wonderful word. Thank you, Roberta, for bringing that up.
And however we determine in our letters, remember, our lens, we'll pull out things citywide, is our district. And there is an overwhelming sentiment that our district has many things one against the other right now. And it is definitely concentrated. So that's a sentiment in our district. We hear from the public. I think you're right, Roberta. We can't take the leap without the data, but at the same time, we have the data for our district, and we can speak to that because we have probably the best data of any community board.
And JD?
Yeah, Roberta and Sabrina, come to my block. We have 6 blocks in my block association. We have 8 social service facilities, emergency shelters, 8 in the 6-block area. Sometimes we don't know that these places are there, which is a good thing, but I really suggest you get more acquainted with the neighborhood. And I believe there have been 15 emergency shelters from 27th to 57th Street opened recently. That's quite a lot.
Yeah, I think what we should do, Roberta, is that we will note in the letter from August until the present how many new locations and beds have opened, because that's a significant number. That's and that's just factual.
You can that I think is certainly appropriate, or something that we can measure.
Right, because there's no question about it.
And I just, if I may, I don't dispute the number of beds or the clustering of facilities in certain blocks. Just, we don't know what's going on in East Harlem. We don't know what's going on.
But our job, we're going to take anything out of talking citywide about this. Our job is, Dolores, you're on mute. Our job is local, period. So, we're not a citywide board, we're a local board. Can I ask, are we okay with this here? Sorry, Katie. Katie's next.
Yeah.
Sorry.
Katie.
Yeah.
All right, just unmuting myself. I guess I'm a little, just thinking about a point that Jessica had made earlier this week when she put comments in the letter, is that that the letter seemed to be sort of trying to address two different things. The letter, we say at the top that the letter is about the Artel and the issues about the Artel, but then we start talking about, this concentration point. And I guess I'm just wondering, should it be, Jessica raised the question, should this be two separate letters? Because it's a little unclear to me why the point about the concentration, like how that's relevant to what we want them to do about the Artel.
Joe, before you speak, I would like to ask if anyone else on the committee would like to respond to that.
Yes, I would like to respond to that,
And,
Katie.
and
that's a
JD,
good- that's-
JD, you can respond,
sorry.
and then I just wanted to say, if anybody else wants to respond after JD, just put your hand up. I can actually see when your hands go up. Go ahead, JD. Thank you.
Sorry. Yeah, Katie, you raise a good point, but I think the letter is also about what transpired at that meeting. So I think it also memorializes all the larger discussion that we had at that particular meeting. So it could be two letters, but at the same time, it is about the meeting itself.
All of our letters are.
And Yadira also has
sorry,
her hand
Yadira.
up.
Yeah, Yadira, you go first. Sorry.
Thank you. I just wanted to agree with JD that the letter does memorialize everything that was discussed at that meeting. And I will say that I certainly don't agree. I don't think it should be separate letters. It should all be in one.
Okay. Do you want to elaborate on the reason you think it's better to be all one?
I just, honestly, I don't think we need to waste any more time in drafting another letter and getting our point across. I think one letter with everything in detail is a nice, concise list of concerns.
I also note, I think that when we read our letters, we always put context around whatever we're talking about. So it's something about the Artel on 39, but the Artel does not exist outside of the context of the constant pattern of activity by DHS. I want to go back to our prior conversation for a moment. Aurora said, wasn't it great to have HHC say, here's the next shelter, here's where we're doing it. It's sort of like, it's a different style and manner of engaging. And this is a big chunk of our problem is that the presentations are extremely poorly done, rushed, and then never clear. So I want to bring us back to some of the language here. So I think we're okay with the clustering. That was a good, got a thumbs up on the clustering and not concentration.
Mm-hmm.
No? Yes?
Yes. I think I think.
I'm going to Roberta. I see a face. I'm up and down trying to see faces. Are you propose that word? So I'm hoping that you support the word.
I support it.
Yes.
I'm
going back to it. Sorry, folks.
At some point in the letter, it does not have to be here. It might be better for an earlier section where there's more elaboration. If we are going to say that there are unintended consequences, we should say what they are, and whether if the
Got it.
Just say what they are, and I'm happy to elaborate that when we get there. But
and I think, and that's the way to handle this is that is when we get there to lay them out. Perfect.
Mm-hmm.
All right.
Yeah.
So let's go
examples.
Up again. I'm trying to do the things that we're not going to have a lot of discussion about. Okay. Now this one is pretty clear. Just this is factual, saying how many sites, how many shelter beds, and supportive housing. That's basically this is a reduction from the map. That's all. Everyone's agreeing with this?
Yep, fine.
Okay.
All right. Now, what else do we have here? Okay, let's try this one, 73 to 77. So the discussion at the committee was that this location was a bad thing to do because of the location and the drug market. So I don't know who struck this. Is this Katie or Roberta or Jessica? If you can speak to the rationale.
I believe I struck it. I do. So if you'll hear me out, one,
Yes.
I do believe that we note drug activity in the corridor in other paragraphs above. But the second is, I think we can do this without drawing, you know, there's some very colorful language about the 8th Avenue being a drug market. I just would argue that just spending a good amount of time on 8th Avenue, I would not describe it as a drug market. It is a street that perhaps there is a drug problem on, but I think we can just be pretty plain in our language here.
Oh, I see what you're saying. Okay.
I'm going to let Dolores go first and then Yadira on this one.
Dolores, Travis, and then Yadira.
That stretch has the highest number of narcotic arrests in the city. I'll let Travis go.
Dolores, you beat me to the punch. I was going to say the same exact thing. That stretch has been characterized by our local police department as having the highest drug market.
That stretch is the subject of the special narcotics prosecutor for the
Excuse
entire
me,
city
Joe.
of New York.
Wait a minute. What about Yadira?
I'm sorry, Yadira. I missed the hand. I apologize. You got to call him out.
Okay.
I can't see him. I can't see him.
Sorry, I'm talking a lot today, but
Please.
8th Avenue is terrifying, and I walk up and down that street every day to and from work, and I am terrified that I am going to accidentally get high on something because there is so much drug activity going on up and down 8th Avenue, and I walk from 42nd all the way to 29th Street. So there's that as far as my opinion.
And Aurora has her hand up, Joe, before you say anything.
I wonder.
Okay.
I'm off mute. I unmuted myself. I wonder if we were just a little bit, again, it's like wordsmith.
Sure.
If we were a little bit more clear, because I know exactly the specific spot I think we're narrowing down on, because I believe I was at that meeting. Down by 30, like in the 30s. I actually went with you guys to that methadone clinic. If we could talk more about that specific piece of 8th Avenue, would that make it feel more comfortable to people to put this in?
I mean, the main narcotics arrests are happening from West 36th to West 45th Street. And
Why don't we?
I really want to ask Katie, this is just a kind
We
of.
say this.
Could we put that in?
No, we do say it. I believe we have 2 paragraphs, or the first paragraph on public safety concerns here.
No, in this specific sentence, it's never too, I mean, I always believe that it's never too much to put more information, especially if I'm trying to drive in a specific point. This is a specific point that I would like to drive in over and over and over again, personally. So if we put that in, why would it feel more comfortable?
Roberta?
I would just refer back to that first paragraph, just because you spend an entire paragraph detailing this information. I don't think it's necessary. If you'd like to add it in again, that's totally fine.
Okay. Yeah. All right. And then now I see Yadira, Dolores, JD, and Katie. So Yadira? Unless that was an accident.
That was an accident. Sorry.
Okay. Dolores, JD, and then Katie.
I don't understand why we're trying to be comfortable around the actual uncomfortable truth. We have the highest narcotics rate in the city right within our community. Why are we not advocating for our community to have safety where we live, where we work? Why are we trying to get comfortable around cute language to make it sound like we're not insulting anyone? We're trying to advocate for community needs. And having listened to the community meeting, the fact that we're going over a letter that we already voted on, that then was voted out of full
It's
board.
okay. It's okay. We're doing it. We're doing it, right?
But why are we accommodating the fact that this committee voted for this letter? And now people are uncomfortable with certain parts of the language that's still expressing the sentiment that came out of committee. That's my problem.
Thank you, Dolores. JD?
I want to support Aurora's suggestion that we get very specific. If the word teaming is too over the top, then let's specifically say the highest number of drug arrests, I believe in the entire city.
It is, yeah.
Is in Midtown South. And we can specifically put that in the sentence. And I agree with Aurora. Let's be specific.
Thank you, JD. Katie?
Yeah, I agree that we should be specific, which I think we are in the paragraph up above. And I guess I just frankly trying to figure out, again, now it seems like maybe we're trying to combine 3 letters together, but if we definitely were talking about our concerns about drug activity, but I don't understand what this has to do with the Artel. If the point is,
Katie, the Artel does not exist on an island. It exists on West 39th Street, immediately adjacent to the stretch of 8th Avenue with the highest number of drug arrests of every 70 of all the precincts in the city.
Right, which we say, right.
I think it's important to note we're putting asylum seekers in an area that has the highest number of drug arrests. I say, let's take out the phrase teeming drug.
Perfect.
Okay, because somehow, I will say honestly, I find shocking that we're concerned about saying how bad it is. It's bad. And Roberta, when you said it doesn't look like that, I know factually there was a stabbing in front of Chick-fil-A early last week, which led to the shooting on 8th Avenue on 43rd Street later in the week. They were both drug related with a specific number of people trying to get turf, which ended up directly, Clinton Housing has a building 307 West 43rd with blood coming down our door that we had to have a super clean the blood because the person who was stabbed went there. This is all real. It happens every day.
But we're not suggesting any of that was.
No, but you're saying asylums, we want to say that asylums, this is the proper space for people coming from having gone to the Darien Gap and gone through trauma after trauma.
It's not.
I mean, I got to ask the both of you directly. Do you believe if there was another choice for this location, for a hotel, that you would choose this location, putting people who are highly vulnerable adjacent to this kind of incredible illegal activity?
I think it's so important that we, for our whole community, focus on safety issues, and for the hotel, focus on what we want to change there.
The hotel doesn't
combine the
exist
two.
outside.
Wait, Joe, let her finish.
Go ahead.
Yeah.
I'm sorry.
Let her finish.
Right.
So
because I have a few things I want to say after.
Yeah, I'm concerned that we're in a letter where we say that it's a letter specific about a hotel for asylum seekers, that we're putting in language. I mean, we've already said that we're concerned about their safety, which is awesome because of where it is, which is great. And I think my concern is, and it's what Roberta, I think, said earlier, is that this language about sort of saying it again and that, frankly, doubling down on making it sound like creating a linkage between the asylum seeking hotel and the drugs. I just want us to be as careful as possible.
It doesn't say that. It says to ensure the safety of asylum seekers. It does not say they're selling drugs. So I'm sorry, you cannot conflate that, and that's not as part of our public discussion. I really take exception to it. It's not what it says.
Well, okay.
It doesn't say that.
I'm gonna call on Roberta, and before Aurora, I want to say something.
I think that the amended language ultimately does reflect the linkage between the public safety concern that exists in the community and then the safety of the residents of the shelter. I appreciate the edits to that effect. And then I think the ask there, just so we're clear, is just making, I believe at some point, and this may just be on the next page, that it's just connected to the security ask somewhere else in the letter.
Yeah, right.
That was it, Roberta. Okay, she put her hand down. One thing is, Joe, I don't know when we want to allow attendees to speak, but Dolores let me know that somebody has their hand up in attendee section. The thing that I was going to add, I don't even recall. I think it was something Katie was saying, or if we're talking about doing 2 separate letters, it'll come to me. But in my mind, we really need to do, it's one letter, And it is not two separate letters. And I think if we're going to be talking about this specific site, we have to mention the location. And since I was a little girl, walking along 10th Avenue really felt uncomfortable, right? And now when I walk along 10th, it's very different. Prior to COVID, walking along 8th Avenue, I have felt very uncomfortable. When I walk along 8th Avenue, I still feel very uncomfortable, right? With seeing what is happening. And if you stand on the corner, any corner in this short, in a short amount of few blocks, Roberta, I don't know how you cannot feel a little bit uncomfortable, but some of the things that can be seen happening. And the fact that some of the things that were already mentioned that are coming from that precinct about the area is alarming. And I am not okay with the fact that a family shelter is right there. And one of the things that keeps coming up when I have spoken to a few patients where I work who are asylum seekers, or I'm hearing stories from other people who have direct knowledge from asylum seekers, and I'm hearing about some of the traumas that are experienced. But I just think we need to do better as a city and be a little bit more mindful of the location. And, I don't think, and I do believe that we are all, I do believe this committee is on the same page about supporting asylum seekers and also understanding there's quite an amount of clustering in this community, right? And having too much is not really good for everything in moderation. Let's spread it out a little. I mean, but this is not about not supporting asylum seekers. And I think we all agree on most of everything. And I'm glad that we're going through the letter publicly and tweaking this. And I do have to say, when I sent this letter out to the entire committee, I received more feedback about how good this letter was than the requests to table it.
So
okay, I just needed to say that.
I think we kind of beat this paragraph to death, but in a good way, right? Can I get a nod that this paragraph now, which says, to ensure the safety of asylum seekers totally unfamiliar with the city, let alone the stretch of 8th Avenue from West 36th to West 45th Street, to the highest number of narcotic arrests in any precinct of the city of New York. And that we also request they meet with Midtown South Precinct Council to keep them informed of security concerns. Are we good with this revised language? Nod, thumbs.
Yeah.
No.
Yeah. Can you just just go back up, because I just can't see the paragraph above it, because I think that's now says what you so maybe we should combine it.
We haven't really touched this yet.
No, the one, sorry, it's the first one where we're talking about under safety and all the arrests and things. Yeah, so you see under the first paragraph there that's in yellow, I think we actually said the same thing we just added below. But anyway, you can check it later.
Yeah, well, if it's double, we can pull it out.
Yeah,
we can pull it out. Yeah,
that's all.
Yeah, we added the streets, actually. I forgot about that.
Yeah.
Yeah.
And then Aurora and JD had their hands up, Joe.
Yeah. Okay.
Aurora.
Katie, I'll blend those two into one paragraph. Understood. Go ahead.
So I just keep on hearing a lot of like, we're saying the same thing over and over. We said it in the previous paragraph, and I just kind of want to echo what Dolores was saying about like, why aren't we advocating and it for our community? And many, and I do want to emphasize this, many people, including Dr. King himself in his letter to Birmingham from Birmingham jail, goes over the same points over and over and over again. It is not unacceptable to do that. It actually makes your letter stronger when you do that. So I don't understand why we wouldn't be advocating the same points over and over again and articulating them in a different way. To sit here on this call all night, it feels like to sparse out pieces of this letter to go through, sentences that it seems a little bit redundant.
However, I do want to say that we're trying to achieve consensus, and we're getting there slowly and painfully surely. So,
JD?
Yeah, I just want to, Katie's point, Roberta's point, the good points. I think part of this, which we may be forgetting, is that part of our concern is that DHS did not come to us beforehand to know about this dangerous situation. And had they come to us beforehand, which they should do, they might have been better prepared to think about the location. So that's part of the concern of why we are saying this, it's such a bad stretch. I don't know if we say that in the letter anywhere, but it's part of the rationale.
I'm going to put this in yellow for a second to say, I think this is the key thought that ties it all together. In line 69 to 71, DHS in meeting urgent shelter need must act with at least some context of the proposed shelter surroundings and not only opportunistically, we can get rid of the word grabbing, contracting for the latest hotel available, something like that.
That's it. That's it. Yeah, good.
I think it ties, Katie, the two pieces together. If we slim this down into one paragraph, because I think the issue is the opportunistic part of it.
Can you say more, Joe, about what you mean by opportunistic?
Yeah, they just take whatever's available and use it, as opposed to saying, how do you do something and make it, and why not? You don't plan to say, we have a huge need, but don't take a hotel in a bad place. That's like plain English here. They're only dealing with opportunity.
Okay. I will say, I think adding some clarity around that so we can all be certain about what's being said would be helpful, because opportunistically makes it sound like you think they shouldn't be taking from the hotel list of hotels that say they're available, that you think that it should be something else. But so if what you're saying,
I don't think because someone says my hotel's available, as a public agency dealing with social services, I'm going to take anything. I'm going to look and say, how do, yeah.
You're saying like, we want them to be, or to talk to us about, we want them to, I mean, because one reason I deleted this is I didn't know what you meant by opportunistically. Second reason is we actually don't know that they took the latest hotel available. It sounds like what you're saying is we want them to have more of a process. I mean, they may, we just haven't heard about it.
A process with us, can I add that? Like a conversation with us?
Yeah, we have that over and over, right?
Well, yeah, except
That's
that
what
with the
I meant by
emergency stuff.
Opportunistically, I think, instead of doing, right, I don't know.
Yes, thank you, Sabrina, even though you cut JD, but
I'm sorry,
it's okay.
Sabrina, I did not hear that. I want to get it. What'd you say?
I forgot.
she was saying for us.
Yeah, a conversation with us through
with
that
us.
process.
Mm-hmm.
JD?
Yes, opportunistically was the very phrase that the assistant commissioner, whoever she
That's
was,
right. She said
used when she
yes, that's
came to
right.
this committee. And we said, why did you put it there? And she said, opportunistically. I put it in quotes and give the citation, but that is their term. And what it means is, oh, it's available. Whether or not it's good for the community, whether or not it's good for the asylum seekers or the people who need shelter, does not matter. It's available. And that's why Hell's Kitchen has cluster concentration along with East Harlem and a couple communities, because the rent is there, it's cheap rent and something is available. That is their term. I would cite it.
What I'll do is I'll go back to that tape, because I won't say who she is, but she was definitely was assistant commissioner who said, opportunistically, that's what we do. So that's
Right.
a good
The
way to
opportunity is
clarify.
there because the hotel volunteered. We're not suggesting that we think that they should just go seize places, right? I mean, they have to.
No, it's not about this. Is about them taking path of least resistance.
Yes.
And we should just be clear
Right.
with our
Gotcha.
words.
Right.
Or we could also say that. Travis has his hand up.
I just want to echo the opportunistically piece of this, because it takes away, this whole letter is supposed to speak to the humanity of the folks that are involved in the situation. And for them to be haphazardly selecting locations just because the opportunity presents itself takes away any consideration of the experiences that people will go through living in certain locations. So I think that's a key piece in the whole letter.
I mean, the reality, I don't want to get philosophical here, but I was going to say the reality is not every agency, every executive director of a social service agency or people who are in charge of substance abuse programs really care about the population they work with.
Oh, I know that.
and are about the money. Let's make this money, because I can make money with having a bunch of people come in and out who are on Medicaid, or having a site where I'm going to have a definite full house in this hotel, because people are paying over $100. The city's paying over $100 a night for a family. right? And I have a definite paycheck coming in. Not everyone is altruistic, good, and kind, and compassionate and loving. That's just what it is. I'm off of my pedestal.
So I think the portion that's in, we'll do this all in yellow, that it's placing these asylum seekers from a traumatic journey, a budget hotel at a dangerous location. And then we talk about the opportunistically thing. We'll clean up the language altogether, but it all gets put into one paragraph or paragraph and a half. Is that correct? Katie?
Oh, Dolores had her hand up.
Dolores, sorry, Dolores.
But I want to call the question. If somebody doesn't want to vote for it, just don't vote for it. And what I would ask is if we do go ahead and vote for it, please, if you're voting, however you vote in committee, that's how you should be voting at full board. We've had too many situations where we come out of committee, we sound like we have consensus, we all vote on something, and suddenly our own committee members start arguing against the work that's done in the committee and votes against our letters. And that brings us back here where we talk about a letter 3 or 4 months later, going line by line. I don't know how that serves any purpose of us advocating for the needs of our community.
And before the next person speaks, I'm going to mention Betty, if you have any other comments, Pete, Paul, Leslie, Sabrina.
Yes,
I really want to raise voices on the committee of other people who do not take up as much space as myself, Joe, Dolores, JD, Katie, Roberta. Other people's voices are important here too, okay? And so if you can all please speak up, it would be great.
Paul has his hand.
Paul, thank you.
Yeah, I just wanted to, we've been talking about this for a long time. I think just sort of light bulb goes off. I think we've got, here's one way of putting it. This is not for a particular paragraph or a line. We have 3 huge problems in this neighborhood. Number 1, we have more than our share of a citywide problem, the homeless population and now the asylum seeking population. Number 2, making worse, the shelters for both groups tend to be clustered in our overburdened community board area. Number 3, that was the last one as far as I was concerned. When the city folks in charge of selecting where shelters go suggest that they have an opportunistic plan, which is sort of like no plan really, but that's their word. Well, we should remind them, perhaps without being too snarky about it, that what their opportunistic plan has led to is a wonderful opportunistic situation for the people who prey on the homeless and the asylum seekers. That's what they have established, meaning to do it or not, that's what we're living with, aren't we?
Thank you, Paul. And then Joe.
Yeah, I want to take us now to another bunch of lines so we can get through this.
Okay, and also Katie and Roberta had their hand up.
Yeah. So can I ask you,
just make it short, the comments a little bit more brief.
So I want to take us through 112 to 127.
Can I just mention something?
Oh, sure.
Katie.
You calling the hotel address a dangerous location. I don't think that calling that address dangerous is
Katie,
serving.
I don't understand. I'm sorry, that block is dangerous.
Okay, but specifically, I just think that as a community board, all I'm saying is I think us calling out any particular business or any particular location as dangerous itself, I think is wrong. You can say that the area is dangerous. I'm just saying don't call this poor hotel who frankly wants to be able to have people rent its rooms later. I'm just saying don't call that hotel all by itself dangerous. Just take out the word. You can say it's a dangerous.
Can you edit? Can you suggest an edit? Let's just suggest an edit.
Just take out the location or just say dangerous neighborhood. All I'm saying is don't call the poor hotel.
First of all, it's not a poor hotel. Somebody owns it and makes money. Okay, it's not really poor.
Right, we're not
no. She didn't mean that, right?
Well,
I don't know where it is. Where
in a budget hotel,
line 69.
Okay, it's right here.
Line 69.
Placing asylum seekers directly from a traumatic journey in a budget hotel at this dangerous location.
In this dangerous neighborhood, if you'd like.
On this dangerous block, because it is a dangerous block.
Okay, block. Thank you. That was a good suggestion. Is that, Katie, what do you think? Is that
That's fine with that. And I just was going to say, if we don't want them to choose the hotels that raise their hands. If we're asking them to change their whole process, we should be more specific here and say what we want. Or like say, we'd like you to prioritize, or we want you to look at whatever, safety records first, whatever we want them to do, we should be specific.
You want us, you're just talking about us being as specific as possible. Okay.
I want to bring us
Paul?
down. Can I bring us down to the next paragraph so we can move it along a little bit?
Oh, I don't know. Paul, did you want to say something? Oh, no, you didn't.
Yeah,
Okay.
no, sorry, just lift the hand up.
Great. Thank you.
Okay, so lines 112 to 117. What I recommend first that we just delete this thing about beggar's belief, is that everyone's all about no hyperbole in the letter. So we're done with that.
Okay.
And then the ongoing, why is there a concern about the culture of secrecy? Because that's, we've heard over and over from the public that DHS will not, at DHS at our meetings and they won't say anything.
Or
What is
maybe
it?
we can, or maybe someone can recommend a different word, a different phrase
Right.
for that.
Omerta.
Lack of transparency. We use that word a lot.
I would second that. I think that gets
That
at the
sounds perfect. Thank you.
Okay, so lack of transparent inclusion and transparency, right? So
Yes.
we're gonna use some current jargon, and that'll
sounds
get
good.
everybody on the same page, right?
Uh-huh.
Now we say that that CB4 can no longer rely upon information provided by DHS to be truthful or accurate, and that was changed to timely or inclusive. Why can we not say the
Truthful and
agency is not
accurate
truthful and accurate?
is, we've been told in countless meetings, we are not opening any new shelters. And then the following day, they open one.
Mhm.
Now, we can
Again.
say that the person who told us wasn't intentionally lying, but they're getting their information from an agency that operates by not being honest with communities. And why aren't they honest with communities? Because most communities say, not in my backyard. We
Right.
happen to be a community that works to get to yes and works to make it work. So why aren't we calling them out on the fact that they have a partner, which we've told them, you have a partner, work with us, use this sister agency as a way to go ahead and make this possible and make this actually work for everyone involved. So that they aren't being truthful and they aren't being accurate.
I agree, Dolores. They've been dishonest. I wouldn't even take out the accuracy part because inaccuracy might just be negligence or lack of knowledge. They've been dishonest. So I think timely and inclusive is not the word. Those aren't the words.
Aurora would probably be raising her hand right now if she were fully present, but
I
because
am
she is
fully
com-
present.
Oh, okay.
I am. I'm listening. I'm just actively listening, and I do agree. I think I've been a little bit too enthusiastic today.
So I guess one of my questions is for the broad members of the committee. We frequently, when an agency acts improperly, we indict them in a letter, and that's appropriate to indict them. I will say that one of the things that was the most disturbing to me was a phone call Jesse had with Leilani, who's such a good public servant, who
Yeah.
said specifically, no, blah, blah, blah. There isn't, what are you talking about? This will not happen. And then 25 minutes later, he got a call from her saying the skyline's being opened. She did not know. I mean, it's just not accurate. And it's not truthful because they're not being told inside the agency what's happening. I never indict the individuals here because they're the people who are trying to do the goddamn work. But the agency is the issue. And we say, even while managing solid working relationships with DHA staff, that we can no longer rely upon information provided by the agency, you should say that, right? To be truthful or accurate. I mean, I ask the committee members who are concerned about this language, voice your concerns and let us know why so we understand it, because we're trying to come to common ground.
Would it make it? Yeah, I think it's better if we can vote, and you know what I mean, all in favor of this letter. And I was going to say, if we take out the word truthful, does that make it? Okay. I saw Katie nod. I don't know what Roberta says. Aurora, put your hand
I
up.
have no
Aurora?
notes for the letter. That
Okay.
particular.
Aurora?
I have a hard time taking out the word truthful because I had a personal experience where I specifically asked a very direct question. And I think many of you were there to experience this. A very literal, direct, could not get any more specific question of, are you putting up any more hotels, shelters in our district? And I can't tell you that, not at this time. And 12 hours later, there was another shelter. That is not truthful. You cannot tell me that you did not know that 12 hours before. That is not truthful.
The only thing I would say, given what I know about the inner workings of DHS, it is possible that somebody actually didn't know. And that's not our problem. That's not our problem. And I think we still need to write this letter and hold them to task and raise the bar a little bit and not lower it and say, because it's an emergency, you can do whatever you want. Let's still have some notification. Let's still have some process. So, I just want to share with you, sometimes people don't know what's going on.
Right.
That wasn't Leilani either. That was like
somebody above her.
Above her.
Yeah.
I think two people actually above her who should have known.
Yeah.
I would. Yeah. So,
JD.
Yeah. Sorry.
Just trying to work my way out of this. Would it be possible to say something like, even while managing solid relationships, we simply can no longer rely on information provided by the agency unless the following steps are taken? And then we have those two paragraphs. So instead of just accusing them, we want to say, this is not working, colon, here's what will work. So will that be a way out of this impasse?
I don't know if we're at an impasse. I think, I mean, I knew at some point we get to difficult things in this, and then we need just to say, do committee members agree with this language or kill it? That's the way to do it, because we're like walking around the block, and it's okay. We should, because it gets us to a good spot in most cases. But then there's going to be some things we're going to disagree upon, which is what adults do all the time.
And I think we're actually in violent agreement at the moment that we, which is, and that I agree with the example you used, Joe, and what you said, Maria, and what you said, Aurora. Like, I actually think that all these people, I mean, the meetings I've heard, the things I've heard them say is, I don't know of any being opened. I can't tell you of any being open. They don't know. And then it doesn't surprise me at all that 24 hours later, somebody else, it's opened. But I don't think that they have, I'm delighted with the suggestion of just taking out the word truthful and whatever else you'd suggested, because I agree they should know, but I honestly think that there are lots of people.
Katie, let me ask you a direct question. If we keep the word truthful there, are you going to be able to vote for this letter, in favor of this letter?
Probably not. No.
Okay. So this is a good point we come at as a group. And by the way, our problem in general on the board is that we don't get to sit in the rooms and talking back and forth. We're doing our best in this little Zoom shit, right? And we're very, very good at it, but it's not the same to be in the room together, right? Yeah. I would like to say here that we are not indicting the individuals. We said, while managing working relationships with the DHS staff, but the agency itself does not provide truthful or accurate information. I believe that is actually what we've heard 10 times over from the public, from committee members, and I would appreciate if you just say, I don't agree with this, and therefore I cannot vote for this, and that's okay, because I think I'm getting a sense of the broader committee that this is okay. So I'm going to do a quick one on this as a quick check. Give me a thumbs up if we keep the truthful and accurate.
Yeah, put your hands up if you think we keep truthful and accurate.
Okay.
Yeah, put your Zoom hands up, please.
Well, no, but I'm seeing fingers though too. Like,
oh, I can't see any.
Now I'm scrolling through, and then people who are against it.
What are we supposed to? Sorry, what are we supposed to do?
If you are in favor, I've already gone to the favor. If you are against it, meaning you want to take it out, raise your hand. Just raise your physical hand. That's fine.
If you
want to delete truthful and accurate.
If I wanted to leave accurate, but take out truthful. Yes.
Okay. All right. So therefore, democracy in action. We had a whole discussion about some words, and it's everyone's in favor, one against, and therefore, and if you will vote against it, the full board, that's okay. But at least we have a process here where we all came to a conclusion, right?
Yep.
So it looks to me that also this whole business here, right? Now we're in good, because the rest of these things were not controversial at all. I'm going to highlight them and we're done with this section, right? So
And
I know
Dolores,
Dolores, it's taking a long time, but we're getting through this. It's, murderous. Yes, Dolores.
Again, I think what you just said is important. Everyone is welcome to go ahead and vote what they think. I don't know that we need to continue to go line by line because all we're doing is arguing semantics and going in circles. Again, I'm calling to question. And to your point, Joe, about we're indicting the agency, we certainly are. And that's part of what we need to be doing. However, what is always helpful that this board always does is we provide suggestions, but we don't tell the agency how to do their business. And I think that distinction, it shows up in this letter. And it was a good letter to start with. I agree with a lot of the points that we've made collectively as a committee to make it even stronger and even better. So I'm still calling to question.
So I'm going to again try to get to our last two pieces, and we're almost there. It's 8:45 and we're in the home stretch, folks. Now
we are going to be done by 9.
Right. I've left the two hardest parts for last, right? Because we had to get consensus around something. So the original letter said lines 48 to 49, concentrating a high need social, a social service, highly social service needy population with an X block radius is not a strategy for success, either the clients nor the community. And then that was deleted. And the addition was the board supports appropriate siting of shelters throughout the district, but has concerns with clustering the number of facilities in a several block radius. Let's start this off going from Dolores. Hand up.
Jojo, I'm sorry, I'm not following this. Where did you jump to?
I'm on lines 45 to 50. And the addition was proposed to add in that Manhattan Community District 4, I said that'd be Board 4, supports the appropriate siting of shelters throughout the community district, but has concerns with clustering a large number of facilities in a several block radius. This was an addition. I guess it was either, is that Roberta yours or is it Jessica?
Sorry, I'm just taking a look at, it may have been a collaborative effort. Okay.
And then we deleted that concentrating a high need social service population with an X radius is not a strategy for success for neither for clients nor the community. So this is I think we're having a definite difference of opinion or point of view here. Let's talk about this. So if you could, Roberta or
Travis has his hand up.
Oh, Travis, sorry. And then we'll come to you, Roberta. Travis.
I'm just going to respond to the question that's there that says, why is it not good for the clients or the community? There have been studies after studies done on this by universities like Harvard, University of Michigan, University of Chicago that says one of the leading indicators of rises in crime and generational poverty and all those underlying factors are created when you concentrate high need populations in one area. And essentially what the city is doing by concentrating all these services in one place is, excuse the hyperbole, but like this is how you create a quote unquote ghetto. Like they're creating a social needs ghetto by squeezing in all these people in one location. There's endless studies on this. So that's the response to that question. It's not even, that's not an opinion, it's a fact.
And then JD and Yadira have their hand up.
Yeah, I'm going to throw this back at Roberta and Katie. What do you mean by appropriate siting? You want everything else to be specific. What does that mean, appropriate siting?
Shall we let
JD, if you're asking the question, could you refer to the line? I'm sorry.
I'm sorry.
Line 45. 45.
You say we support, Manhattan Community Board supports the appropriate siting of shelters. Well, what does that mean?
It refers.
What's appropriate?
In line with proper community planning as detailed in the letter. If we'd like to utilize different language, I think that would certainly be reasonable. But I think appropriate just refers to everything that we then state within the letter itself.
Subsequently, right.
Okay.
I think down below we use the word thoughtful citing.
Okay.
Thanks.
And
Yadira?
Yadira, and then Paul.
I would like to say, Travis, well said. Amen. Thank you. And I would like to say that I do not like that the original statement was removed. I am in favor of the original statement, concentrating a high needs social service, blah, blah, blah. So that's my opinion.
And Paul.
Yeah, my only
Thank
concern
you.
with the first part of line 45, it sounds like even though we've said elsewhere that we think we have more than our share compared to the rest of the city, it sounds like we're saying we support the appropriate siting of shelters without adding a word like, for instance, I don't know, proportional. It sounds like we're just saying, yeah, it's okay. Yeah, more the merrier. That's
That's a good point. Thank you.
When you say appropriate, you suggest that everyone else will infer what we want, which is that our share, certainly, but not more than our share when it's a citywide problem. That's all.
Thank you, Paul. So like a fair share. Aurora?
Yeah, just to Paul's point, our share, and I think this needs to be expanded if we're going to go with the amended version. It needs to be expanded and very well explained. Even if you explained it up top, you need to explain it again. It needs to be hammered again, what you mean by appropriate. Just the proportion size, but what does appropriate mean? Appropriate can mean you only want women and children. Appropriate can mean various things. So a very clear example of what you mean by appropriate.
So maybe we just sort of try to bring this back. Sorry.
I was just going to make a suggestion. It's me, Joe, because there's something about this sentence that just makes me feel a little uneasy. I'm going to suggest something. It doesn't have to be taken. It's fine if it's not. I'm still voting in favor of the letter. Manhattan Community District 4 supports or is not in opposition, something like that, of citing shelters in our district, but has concerns with clustering a large number of facilities in several block radius.
So
I think that captures.
That's what that's my
yeah.
suggestion. If it's not taken, that's fine.
So I think one of the things we need to do is this thing here, I believe belongs down where we talked about how to plan or whatever. The thought of this first paragraph was about the high need social, the concentration, right? So if we take this, which is more down in the planning part, right? Let me just pull this out for a second. Bear with me, folks, please. This whole thing where we have this, hold on a sec. Here we go. This whole area with the planning, right? I think it belongs in here. It's not in the right spot right now if I put it in, but I think this is where this belongs, Katie, right? So it's clear that we actually can start with that. You can say that we support, like, thoughtful, whatever the words are. I mean, I'm sorry, Roberta, I'm sorry.
Yeah, I think that
This is the location for it, right?
I believe that should be okay.
I can't make it move down to a separate bullet because
No, I understand what you're doing.
But yeah. So, and then let me come back up, right? Because I think the point of this first paragraph, right? And by the way, guys, we're in the home stretch for real. We're almost done.
10 minutes, all right.
In this first paragraph was the concentration of a high need social service residents, right? So I think, given Travis's statement about the issues of the studies and such, I would say if we just say with concentrating a high need social service population in a block is not the clients of the community. And then I'm going to ask Travis to do something. Travis, we'll footnote to some like empirical studies. So it's clear, we're not pulling this out of our ass, guys, but this is truly a proven fact. And I think that helps us support this, right? No? Yes? Give me some thoughts.
Yes.
Yep.
I think the edit was just, if we're going to write this, we need to say why, and being able to do that is a positive thing.
Yes.
Right.
All right, so we're all in agreement.
Good. So I can't get to the footnote part of it, but it'll be footnoted is the thing. I'm sorry. It's covered by my stuff. So as do we have consensus on this particular change?
Yes. I mean,
Yes, with like a footnote to some study, so it's clear. Everybody good? So I'm sensing a yes, right?
Yes.
Okay, good. Now we're going to go down to our.
No, Joe, does it have to be a radius? Is that part of the sentence or what?
Sorry, I'm back. Let me get back to it, JD. I apologize. It's X number of blocks it's talking about. It was just trying to quantify it. That's all. Because we have so many shelters right at this location.
Are we taking any comments from the public?
Yeah, I think we should as soon as we get to the conclusion, which is right coming now. And here we are. We're at the conclusion. We do want to hear from the public. There's no question. Okay.
Are we taking my suggestion or are we leaving it?
Which is what? Sorry.
The part about we're not in opposition, but the clustering, instead of saying we support.
Yes, I'm going to get, let me get back to that for a second. Got it. Okay. Now we're down to the conclusion, folks. So, to ensure the success of social service facilities and shelters, they must be cited thoughtfully and carefully, with the facilities distributed more evenly among neighborhoods and the community districts. And then the deletion was, and must not be over concentrated in any one neighborhood. What's the thought for taking that out, Roberta?
Okay, Roberta.
I think that now, assuming we can kind of take into account the discussion that we've had about this letter, it might be just better to say facilities clustered.
Got it.
In several blocks.
I don't agree with that. I'm sorry. They are also concentrated as well as clustered.
Yep.
But
So
I think Sabrina brought up this point that we don't have the data to say that.
Yeah, I don't understand.
What's the difference? But just for clarity, Roberta, I'm asking Roberta the difference. How would you describe the difference between clustering and concentration?
It sounds like concentration is saying that Manhattan Community Board 4 has more social services than other places. And that might be true. But I think it muddies what we're trying to say, which I think we're pointing to a problem where we have a couple of blocks that are particularly dangerous and that we think are inappropriate for this particular siting. We should say that. I don't think that we have evidence to say that there is an over concentration. I don't think it's specific. The
one thing I didn't say earlier in response to that and Sabrina's point is that a couple, Joe always mentions where the community board with the highest social services, I think the third or the fourth. And I actually did some research when I was on a budget and task force. I forgot how many years ago. And we were actually number 3 or 4 out of all community boards in the entire city with the highest number of social services. I couldn't believe it. But there's actually a document with data for every community board in the city that includes like hospitals, schools, social services. And that's what I happened to find on the internet. And I saw that data. I don't know if I can find it now, but
I mean, we have in supportive housing, we are number 3 out of 59 community boards because we've been so welcoming to supportive housing. That's just factual. I think I would like to understand underneath it. There's something underneath this that I'm not understanding, because I frequently deal with lots of folks about elected officials, especially about data. This is the experience that people have in our neighborhood every day. And I got Aurora go, and then if I can just ask for Bert and Katie. So I'm trying to understand where this comes from.
There's 2 sets of data, just talking about data, there's numbers and there's quantitative data. That's the narrative data that you get from people. And I think that that's the difference here. What you're looking at is just like a sheet of numbers, and a sheet of numbers will give you something. But what I'm seeing in our neighborhood is a narrative, and I can see with my eyes the amount of shelters that are going up. I can see the amount of supportive housing that is going up. I can see with my eyes how the stretch of streets on 8th Avenue gets a little dicey. And when I say a little dicey, I'm being very generous. After a certain time, and really at any time, I can see that. I can't put that on a spreadsheet, but if I could write a narrative, myself and 100 other people would have the same vernacular. So I'm sorry that the numbers can't give that to you, but if we had a narrative, you would see it.
Dolores?
So broadly speaking, what Dolores Rubin sees walking or biking down the street or driving down the street is irrelevant. What's relevant to me is what I hear when we have people from the public come to our committee meetings, when we have people come to our block association meetings, when we have people come to the police precinct council meetings. And I think for 2 years, we've been hearing over and over again, and it's not the same people showing up at our committee meetings. We had over 120 people, I think, show up at one meeting, and for 3 meetings straight, we averaged 75 to 100 people that were all concerned about the enormous number of shelter and other social services that are in our community. Now, granted, Community Board 4 goes from 59th to 14th Street, roughly 8th Avenue to the Hudson, and not all of our community board has seen the concentration, but it's real, it's here, and it's not about saying whether or not that concentration is relative to the rest of the city, because what we're experiencing is a lot of siting that happens here for opportunistic reasons because there are empty hotels that are available. That's a fact. So we're trying to go ahead and get comfortable around not speaking plainly to the needs of our community. And we're also, it sounds like we're all talking about our own personal lived experiences. We're community board members. We're representatives.
So, we may or may not be able to all come to a conclusion about the same thing, because what I do, Katie's, I'll say one thing, Katie, I recognize you. It's that what I've seen here in this change here, in this conclusion, is sort of taking the language and just making it much more technical or separate from the experience of the people that come to our committee and have talked about this over and over. I think we owe people who come from the public to voice their concerns, and we have to do that at some way, So, sorry, Katie, and then Roberta.
Yeah, Joe, I totally agree. I think we have to voice people's concerns, and we have to voice what we've agreed to, right? And what we agreed to, the concerns we heard were about safety and this concentration in various neighborhoods. Mm-hmm. What we then ask for in this paragraph, or what was deleted, and I think is sort of what's being debated at the moment, is here we're saying, okay, so, and this isn't actually what we voted on at the last meeting. We're saying, we want to say that you can't open anymore unless you come talk to us first. So I think that's deleting that language is different than not representing the interests of our community. And I also think it's really important that that we're consistent with our community board views, right? Like, we are in the process of suggesting some more social services to come to our community, right? We have this wonderful Bayview, or whatever we're calling it, Bayview Chelsea. So we're not taking a position on our community board that we have too many social services in the entire district, right? And our point is we're open to it as long as they're appropriately cited. And so we just have to be careful about our language. That's what we're saying is we're open to it. Of course, we're open to it. They have to be thoughtfully and carefully cited, and that there are certain neighborhoods where they're just, it's too concentrated. Absolutely, we can say that. We just have to be careful about our words so that we're making sure we are being effective advocates for our community.
So then you would be supportive of keeping the full lines 178 to 180.
They must be cited thoughtfully.
And
yes, I'd be fine with that. Yep.
You must not be overconcentrating any one neighbor. This is a sort of basic statement, right?
Exactly. Yep.
So do we have so we can we're getting closer.
And Roberta and Paul had their hand up. I don't know if it was
Roberta, how
intentional.
about those lines 178 to 180? You're on mute.
I knew it would happen some point. So long as it is clear, because when you were referring to the crux or what's beneath all of this, or the term concentration, what I see is not in my backyard. Like, that's what I see when I read that, and then the rest of the paragraph. And I think that it's important.
That's what I want to hear. Yeah.
That's not what I have gotten from people that I know. And so I nor does it represent something that I would be comfortable voting for or supporting. And I know that there are certainly other people on the board who agree with that. Just one final point: people who come to community meetings are doing an incredible public service, but they have time and resources in ways that people who do not show up to community meetings or are not concerned about, perhaps criminal activity or bothered by shelters, just in a way that is not representative of those groups who don't believe the other side. And so I do believe that as representatives of the community, it's worthwhile just taking that understanding and recognizing that, one, there are problems and people are bringing them up, and I'm incredibly grateful that people take the time to do that. But there are a really large number of people, like hundreds of thousands of people, I believe, in the community district, and most of them are not doing that. And I'm not saying that we can infer what their opinions are, but I do believe that if people aren't taking that time, there's almost certainly a group of folks who, believe that it is okay to have more social services here, that are okay with the services.
Roberta, I want to know one thing very clearly. In the democratic process, those who show up get listened to. That is the nature of it, right? So we as a community board cannot respond to people who don't bring concerns to us. And if there are piles of people who bring ongoing concerns, we respond. Of course, there's going to be a huge diversity of opinion. There's going to be tens of thousands of people who don't care and are here for a moment, for the ride, do whatever they want to do. There's others who are going to be in favor, but we can only respond as people participate in this participatory democracy stuff. I mean, how do you ever change that? I don't know how to change that. I mean, if you don't show up and put your voice to it, who's going to respond to you?
The only thing I would add also, Roberta, I think you make a really good point about there are people who don't come to the meetings, right, and need representation. I think that is the point of agencies, nonprofits, and advocates who come to the community board to speak for those groups. And there are people who are sitting on this committee and on the community board who are advocates and live the life and do the work every day, right? And really care about the communities that you're talking about, right? And I think it's okay to disagree, but I think, can we just get through this letter? It is now 9:08.
Yes.
And I would like to have as much consensus on this letter as possible so that as many people on this committee can vote for it. And I would say, I think it would be unfortunate if you disagree with one word.
And that's okay.
Vote against this entire letter, but that is your right. But I would like to hear what everybody has to say. And I'm going to ask Sabrina to go first because she hasn't spoken as much as Paul and JD. So if Sabrina can speak.
Yeah, thank you. You say underline. I also think not in my backyard. When I first heard this discussion last time we've had this conversation, when I bring about numbers, I bring about sure, obviously our concern is our community board and what happens from 59 to 14th Street. That's what we represent. But I also heard those people saying hey, we are having a really hard time. We're trying to just place people 100% not in the right place. As we stated, that's not exactly blocks that are welcoming or safe or any of the issues that we have said, but it's a little concerning to me. It's like no, we cannot have another shelter here. Okay, why? Well, we cannot have it in this block because A, Y, B, C, D. But also, like, if there is one, we cannot say it's like high concentrated when we really don't know how many shelters are in the Upper East Side, for example. So it's a little, it's just an argument. It's just not, it just doesn't have any base or evidence. And again, yes, to make our point stronger. So that's why, like, for me, anyway, but I couldn't support the letter at that time. And, you know, obviously I don't agree with everything that I said in this. I am with Robert and that say I am a welcoming, I am an asylum seeker. I've said it plenty of times. If anybody's representing here, those voices will be me because I am an asylum seeker. So obviously I have other deeper connection to this community that anybody else can here experience in their life. So yeah, again, everything here, I also echo that, like, not everybody has the privilege to attend these meetings. I don't think it's because they care. They simply just don't have the time.
The time or the resources, always. People have
It's
serious
privilege.
lives. Right.
It's privilege to be here.
Mm-hmm.
And we gotta be conscious on that.
I also emailed everyone on committee the data that I was referencing for all the boards in the city.
Thank you, Maria.
So while we're speaking, I've been trying to clean up this next paragraph. So I'm making the assumption that we're not going to have unanimous agreement on this on line 180 on the words over-concentrated in any one neighborhood. And I find it, by the way.
Actually, I think, Joe, I think you do have it if you have with the words in any one neighborhood.
No,
yes.
Roberta said no.
Oh, I may have misunderstood.
I said that it is contingent on what comes in the next paragraph.
Oh, okay. So then we're still in the progress mode, right?
Yeah, and we still are. And then JD, just so you know, JD and Paul still had their hand up.
Sorry, JD then, or Paul, whoever's first.
I'm fine with the letter as it is written. I am astonished at a statement that we should pay attention to people who do not come to meetings or speak up, but they carry more weight than those people who do come to meetings. I have attended hundreds and hundreds, as Joe has, and Maria, community meetings. I attend every month. I attend every week. And people raise concerns about their children, the safety of their children, and to dismiss that by saying, well, there's a bunch of people that don't speak, and so they probably wouldn't mind as much. It's just extraordinary to me. I don't know what to say.
Wait, Sabrina,
about that.
hold on, let him finish.
I think it's arrogant to the extreme. It's dismissive of the people who do raise legitimate concerns about the safety of their children. I just find it extraordinary. And I do not represent, I have no agenda. I just try to bring to the community board what I hear from my community, people that speak up from all walks of life. And to have this dismissed, Roberta, let's have a conversation, have a cup of coffee and discuss this, because I'm frankly astonished.
JD, thank you for speaking. I agree with some of what you're saying. I also think there has been some misunderstanding from what is being said. And I think it is a conversation for offline.
Can I ask the following too? I'm looking at this.
And Paul has his hand up.
I know. I would propose to delete this sentence entirely about saying nothing else until you would have a conversation with us. But what I want to note here is I'm going to propose that we in the spring sponsor a public hearing about the community's willingness for more social service facilities and shelters, because let's have a public discussion about it. But our goal is to get this letter through. And then let's really have a big, broad public discussion, because we are divergent here, right? Let's hear from a broad range of people. Does that sound like a possible task here now that it's out of the letter?
Yes.
I got a yes, but I got a.
Yeah, well, I have my hand up. I might as well throw it in here now. Is 180 in or out? I can't quite see on my screen.
180 stays in, and it seems
Good.
like we're okay with that.
Good. And the one you just cut out, I was fine with that one too. Look, you know, the thing is, anybody who really wants to worry this down to a nub, we can have the conversation about whether or not we're the statement I've always gone by. I heard it. I forget where I heard it first, Joe, but you've heard it too. We were the number 3 community board out of 59 that had the most social services, homes for pregnant. We were number 3. Now, I'm not concerned about whether we're now number 2 or number 1. I wouldn't be surprised if we had moved up that hit list.
We don't know.
In the meantime, what?
We don't know.
Right. I think this letter is fine. It could be stronger in my opinion, in the direction that I think it wants to go. For all the 40 odd years that I've lived here, I've been sort of proud of the fact that I like this neighborhood for being as receptive as it is. But I will tell you, and I'm not speaking just for myself, I could tell you that the best way to encourage NIMBYism or to lose people who feel the same way, and I think most of the people on this call think that this is a good thing about our neighborhood. You wouldn't be spending time if you didn't. The best way to do that is the best way to lose that is to not see what's in front of your face. And what's in front of our face right now are 2 things. We have much, much more than our share of a citywide problem. And on top of that, it is being exacerbated by this clustering nonsense. It's just a terrible idea. And it's our job to call it to the attention of DHS. I don't know if this letter is the right 2x4 to hit the mule in the head to get its attention, but I support it.
Thank you. So I'm going to, Katie, do you want to have the sort of last word on this one? No? Yes.
Sorry, I just had to unmute myself. No, I was just going to say in line 183, where you say something about from welcoming new social service facilities,
right?
I would just say, in some neighborhoods, again, because we are welcoming them. We're doing Bayview, whatever. Anyway, I would just
right. The truth is that speaks for itself. When it's properly and appropriately cited and thoughtfully, blah, 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 we're welcoming, right?
Right. That's all. So I want us to just be really clear. We absolutely welcome them when they're appropriate. And so that's why we're not welcoming them right now. It's just in certain neighborhoods. That's all. And by the way, it doesn't matter.
So
I was going to say, I think I do support the letter, though I am troubled by accusing an agency, because I haven't done that before in advocacy work of accusing an agency of being a liar, but
don't be afraid to.
By the way, if you really don't like it, I mean this in a sort of process collegial way. Although this was a long discussion, this is better because it's got stuff out on the table.
Absolutely. No, this is so important. Yep, I agree.
And then the idea of coming back and having a big public meeting about this is good. So can I go around the room quickly with all the edits we've made, and everyone's seen them, right? Because they're all in yellow now, right? And the only fuzzy paragraph is the one that's got this thing saying over and over. It's got to be just kind of fixed up. We have made the entire letter yellow, which means we've looked at it and we've suffered through it and also enjoyed our company among ourselves. Can I ask for those of you who are in favor of this modified amended letter to actually raise your hands, from the thing so we can do it.
Can you stop the screen share? Can you stop the screen share?
Yes, I can.
And we also have folks that still have their hands raised in the public, just letting you know.
I just want to go through this. We're going to hear from the public in 1 sec. So I see actually nobody opposed except for Pete, who hasn't voted. You can raise your hand physically, Pete, if you're in favor. Okay, so we have achieved a.
But Travis, he's a.
Oh, Travis, yes. Yes. Okay, so we've achieved a consensus, and I want to thank the members of the public for listening to all of our stuff on this. And yes, please speak to us. Who's the person that can be brought over?
Maybe I need to do it.
There's someone named Sanford Miller, and Brian Weber had his hand up earlier.
Okay.
Because Nellie, are you able to do that?
Yes, I'm doing it right now.
Yeah.
Thank
And
you,
then bring
'cause I
over,
lost-
and then bring over Brian Weber. Perfect. Okay. Sanford, you're on.
Hello. Hello. Yeah, I just want to say that I think, like many people on the board have echoed, I'm proud to have a lot of social services and shelters in this neighborhood. I don't, seems like the data is kind of a murky question, but whatever. It's a significant number, and I'm proud that we have it. And I would just say, like, based on all the edits the letter has received, it is pretty different than the form that it started this meeting in, but it's still that language about like not concentrating shelters in a certain neighborhood of the city, and sending a letter with that language does sound to me a little like not in my backyard. Like, whatever the intentions, even if the intention is to be on the clustering, that is certainly the impression I would get from it if I were just reading this letter without hearing the whole conversation beforehand. I might suggest even adding some language about like, we do support shelters or social service sites in XYZ location, maybe starting with Bayview. In my opinion, that might lead to a more productive conversation of like, okay, this is not a good place. This handful of blocks, which is a small part of the overall community board space. Okay, where should they be? To me, it's really important that this doesn't read as not in my backyard.
So being thank you very much. And considering the least not my backyard community in the entire out of 59 community boards, I think to pick up on Katie's question, I think we'll actually cite Bayview, Katie, in this to say such as Bayview, and we can actually footnote to the Bayview letter, because that's a recent action we've taken, which says, here's who we are. Thank you very much, Sanford. Can we go to Brian Weber?
Thank you. Joe, you most probably don't hear this a lot, but geez, you've been a saint tonight. I would just say that, you know, there are certain individuals that were in disagreement with this letter, and they should just vote against it. A couple of blocks would imply two. We're talking about a stretch of 8th Avenue from 34th to 45th Street. And I speak from a lot of experience and knowledge about it as I serve as the precinct community council president of Midtown South. All right. For the calendar year of 2022, there were something like 6,029 arrests in Midtown South. 1,600 of those were narcotics related. And the vast majority of those narcotic arrests were along the 8th Avenue corridor. So Roberta, I'm glad you've had a positive experience walking on 8th Avenue, but I and my neighbors and the businesses along here experience this drug activity on a constant daily basis. There is not one goddamn day that I walk out my front door that I do not see people shooting up on my sidewalk or smoking crack on the street. So that's just a fact, all right? And that's the lived experience of this community here. It's not just 36th Street, it's in the lower 40s too. And the street that the Artel is on, West 39th Street, 305 West 39th Street, is a problematic street. You know, tell the bridal gown manufacturer who employs 20 females at her place, all of them also immigrants, that they shouldn't be concerned about conditions on that street. She's so concerned that she's breaking her lease and leaving. That is the reality of what is going on here. We've been trying to help that block in any way we can, but we can't live in this vacuum and say that this is not what's occurring here, because it is. And we're getting caught up in semantics of words. So I would just say for those on this board, if you don't want to vote for the letter and you don't like what it says, there are enough people here that do support it. And also to that allegation about there are so many people that support this that don't show up at the meetings. Well, there are so many people who also don't show up at the meetings who have experienced assault and have experienced the ravages of the conditions here. And I'm not blaming this on the migrant hotels, but I will tell you, as someone who lived on a block that had 550 shelter beds opened up in a single day on my block, that chaos ensued, and DHS, despite their efforts, was never able to gain any modicum of control over the conditions and situation. So I don't know if you want to call that clustering. I would call that clustering because there's 2 shelters and it was also a concentration of individuals in there. Also, it should be known that within the past 6 months, 15 hotels have been converted to temporary emergency shelters between West 29th Street and West 57th Street. All right, so that's 15 out of 77. We could do the math on that, but that is a significant number. The Row Hotel, which is not in Community Board 4, but is in Midtown South, has something like 3,600 clients. So that would be concentration. And that is several blocks away from Times Square Hotel, which is a massive supportive housing complex. So again, to Travis's point earlier, we are concentrating individuals with social service needs one on top of another. And guess what? 44th and 8th Avenue, which was brought up earlier this evening, yes, there was a fatal shooting there, which is considered to be a byproduct of drug activity that is occurring there. And the reason the drug activity is occurring there is because there's a massive client base there. So I just think that we've got to live on the sidewalk and work on the sidewalks, because that's where we all walk. And it's been a fascinating conversation that you've had tonight. My hand's gone up and down multiple times. But, you know, I think I'll leave it there.
Thank you, Brian.
Thank you for your time.
But I also want to say that thank you for, as a member of the public, both Sanford and Brian, thank you for lasting through the whole thing to be able to speak. But I really want to commend the members of this committee, because we had a serious, real discussion, section by section, item by item, and we got to a conclusion. So that is a good thing. I mean that, it wasn't easy on parts of it, but we got to something that's a product that all of us can support together. Loris, would you like the last word on this thing? We've
No, Leslie had his hand up before I did.
I'm sorry,
Oh.
Leslie.
Sorry.
Your hand is by that, like you're painting, so I never see it.
Yeah, I never, sorry. I didn't realize.
No, I supposed to take my hand down, but I do, I've lived in the neighborhood for 46 years, and the changes that I began to notice in the neighborhood started back 4 or 5 years ago, Joe, when I raised the issue with you and the board, if you recall, about the Wynn Hotel, the Wynn shelter, the Will Center, and the other one next to me.
Lantern.
And what we have not discussed is the politicians' impact on this. This is politically inspired. Some of these problems are politicians' problems, which are creating a disaster in the neighborhood.
Yeah.
And we need to acknowledge that.
I think when we have a public meeting, we're going to invite some of our elected officials to talk about these things, because some things are uncomfortable to speak about, and it's okay. What are we going to do? We have to talk about it. Thank you.
And also the poverty pimps who
Right.
take all the money from the state, from the city, to establish these institutions and get $500,000 in salary to run some of these projects. It's ridiculous. It's absurd.
Dolores?
We actually have a hand up in the public, but while you're bringing that person over, I just have to say this. We talked through this. We voted. It's a public record that we voted. What I am very concerned about is that vote being different at full board, and we re-litigated it at full board. And that's been happening. Members of this committee will vote one way in committee, and then we get to full board and a whole bunch of new concerns come up. And then we actually, people on the committee who support it in committee don't vote for it. That's problematic. The work happens in committee. The full board is bringing in additional broad voices. But what we continue to see is that people actually are voting against their own committee letters or voting differently than they voted in committee. And that inconsistency is troublesome.
Roberta, then Katie.
I think Dolores brings up a really important point, and I do want to just offer a little bit of context here. So when we agree to letters, We have a wide range of sentiments that are being thrown about throughout the meeting, and it is not always clear what the letter is going to look like when we motion for it. And so that's why it's important to review it. I think it will be really helpful if we have some more time before full board to review the letters in the future. And that'll help prevent people from who generally support the letter from then wanting to vote against it at full board. I think that the daylight and transparency and the conversations that will happen once we're drafting the letter, I think by dealing with those, that we can make that problem, if not go away, we can minimize it massively.
I think the correct word is minimize. It's never going to go away because every month is different in terms of how the schedule works and the timing. And sometimes even on a Thursday and it's already the next week is the, how the calendar falls, right? So I also want to say that perfection is the enemy of the good. And we absolutely have to understand not everything is going to get done properly or fully, or we're going to see it exactly on time. I frequently have to write some of these bare land use letters, right? That are like 25 pages. They're not easy things to figure out, to muck through. So understand that's the nature of it. Hopefully this discussion starts to diffuse some of that we've gone through. We get better at it. There's still going to be times that we're not exactly either on time or not exactly what we all exactly agree to. And it's, again, always remember the broader issue is, are we holding together as a community? That's how we get an effective voice. When we lose our way and just vote against something for this portion or that portion, it looks like we're not really speaking as one. Our community board is so well known for speaking as one. So that's why I'm so always concerned about it. And I'd rather take this time to do it. Leslie, you are a member of the public here, so please speak.
Thank you. Member of the public, also member of Community Board 4. I have been on this meeting every single minute and I've heard every single word. And I think that says more about me than you on a Thursday night, whatever. I do want to say, I want to thank you guys. I actually think there's value to this. And I really want to thank you guys, because not that you could do this with every single letter and every single topic, but I mean, this is really thoughtful, and as painful as it is sometimes even to watch, it brings you to a better place, I think. And I'm not getting on a soapbox. I was really impressed. I just wanted 2 points. I'm not going to say anything about the letter. I'll make my edits at full board. No, I'm kidding. I won't make any edits at full board. But 2 things, Roberta, I have to agree with something Roberta said. And I'm sorry if it's going to ruffle feathers. Like, there are a lot of people who don't come, and it doesn't mean their voices can't be heard. It doesn't mean because you come to every meeting that your voice is more important. But I will say, though, that those are equally divided too. Like, I'm a parent. I know a million parents with kids, well, obviously parents with kids or families with kids who don't come because they can't, right? And I hope to maybe bring that voice. So just because someone doesn't come doesn't mean that we shouldn't seek them out or represent their voice. But that being said, those voices are also diverse, right? It doesn't mean one thing or the other. It's who comes and talks to us is representative of the problem at hand, and we should listen to the people, I think, who bring the problem at hand. I do also want to call out Aurora. Thank you so much. I think it was probably the best comment of the night or thought of the night. I don't know why I'm valuing this. It's like television to me, but whatever. I think that sometimes in our letters too on WPE and other things, we get so caught up in the wording and the specific, stat or this, or what does that mean? And Aurora said, there's lived experience. We are not all experts at one thing. It's lived experience, and that lived experience, Aurora, I forgot what quantitative experience, whatever Aurora was saying, that is so important. So when we're parsing words, I'm very impressed with you guys. Thank you so much. I listened to the whole thing, and I think it's a really, really good letter. I don't know if everyone on this committee thinks that, but I think you should be really proud of yourselves. I mean,
Leslie, your 30 seconds is up.
Goodbye. Goodbye. I'll continue at full board. I listen, I was on for how many hours? Maria, how many hours? Thank you.
So given that we've done our serious work here tonight, would someone make a motion to adjourn? by Katie, second by
Motion to adjourn.
everybody. All those
I
in
second.
favor, please say goodbye tonight.
Goodbye. Good night.
Good night, folks. Thank you all.